Hi, Brent's here.
Okay. I'm going to wait till we get a couple more board members. We do have quorum right now, but we'll wait till we get at least one or two more board members on. Okay. Jeannie Seabold's on now. Okay. Bill Madsen. Liz Stark, okay. Jordana, do we have quorum? Can you confirm?
Hey, Marky, we're good to go.
Okay. And thank you all for joining us today. Though I'm sure there's going to be a lot more people to call in. I see right now there's 288 attendees. No, now it's 291, 20 on the panel. Tom Kurt, good to see you. So we will have a good discussion. You know, this meeting is a very, very important meeting. I know many of you have worked tirelessly throughout the weekend as you've put together your thoughts, whether you're part of ACRA or the restaurant industry or the lodging industry, or those who are elected leaders. It's been a pretty impressive weekend of solid work as we bring the community together around this pandemic. In terms of looking at some of the numbers, and I'm not going to talk about the numbers other than they're startling. I just saw the report from today. And with that said, I'm going to go ahead and call the meeting to order. And Jordana has confirmed we do have quorum. And I'll ask if there's any changes to the minutes or a motion for the approval of the last meeting.
I move for approval.
Thank you very much, Tom. A second. Thank you, Greg. All in support, raise your right hand. Okay, again, very well done minutes. You have the agenda in front of you. And the way the agenda will work for those who do not have it in front of you, we're going to be listening to a staff recommendation first. Then we will be going into public comment, then staff clarifications as those need to be made, then board discussion and decision. So that's how the agenda will flow. I've asked that we not turn on the chat feature. It gets very confusing when about 300, 400 people are trying to weigh in on the chat feature. So we will get into public comment, which will be very important. And I'm going to see if there's a motion to approve the agenda as it's written.
So moved.
Thank you. Do I have a second? Thank you, Linda. Okay. And Jordana, I'm going to ask you to speak, and to all who are on the call and to all of the board members and alternates. The purpose of our public health department is pretty straightforward. And that is that our responsibility is to work with our community. And that's what's so important. The community, we need to all be engaged in trying to solve this problem. We need to focus on, primary focus is to promote health and prevent disease. Well, COVID, we're not doing real well when we talk about preventing disease. So staff has worked very hard throughout the weekend, working on a recommendation that many of you may have seen and discussed. And with that said, Jordana, I'm going to go ahead and turn it over to you.
Thanks, Marky. So if we go to the next slide, I think I just wanted to ground us all in these goals that we came to in the beginning of our response here. You know, our goal is really to be able to reduce our incidence rate in order to be able to achieve these four community goals of in-person learning, increased transportation capacity, tourism in the winter, and economic activity indoors. The next slide shows where we're at currently. So Pickens County has the second highest incident rate in the entire state. That has been increasing now since November. 1 in 35 Pickens County residents are currently infected with COVID. And an incident rate this high is currently affecting the ability of schools to be open, and will lead to additional transmission in indoor settings. This incidence rate is also impacting our visitors to our community. They might not get sick here, but may take the virus back with them to their home community and infect others there. That information is something that we don't have numbers to, but we know is happening. As we think about this virus, and a lot of our initial goals, being able to protect our hospital capacity, I would, give kudos to us for being able to do that. The other thing that we know about this virus is, even from our own data, when we follow up with individuals who have tested positive for COVID, 50% of people in Pickens County who have tested positive continue to have these long-term, ongoing, lingering effects of COVID. So I think that as we're talking about the impact of our incidence rate right now, it's not affecting our hospital capacity, but it is affecting people who get the disease in the interim. It affects our ability for these different settings to be able to stay open. And it is the more people who come down with COVID, it will affect, from our numbers that we've seen, 50% into the long term. The next slide shows our staff recommendation. So the staff recommendation is to adopt new criteria for moving into and out of the red level restrictions. The recommendation is to move into the red if our incidence rate is above 700 for 14 days. So that's the new recommendation. And then the additional criteria we have already been using is if one metric is in red for 14 days and another dial metric goes into red for any period of time, that would be another criteria for moving into the red. Moving out of red level restrictions, we would set out that if the incidence rate is below 700 and has been decreasing for 14 days, that would be the criteria for moving from red back down into orange. What is different about the staff recommendation today that's different than was presented last Thursday is this additional bullet point that we are currently recommending, which is to apply for the 5-star program now as soon as possible, to be able to have 5-star certified businesses be able to operate at an increased capacity after the county sees a 2-week sustained decline in our incidence numbers in red. I'll go into more details there about what that means and why we have included that. So if we go to the next slide, we were tasked from this board on last Thursday to take that recommendation, take it to the community, work with our different partners, and see what the feedback was, and then come back today with what we had heard and the staff recommendation based on that. And so when we went out to partners in the community, we heard three really different buckets of what we should do. One opinion was to limit all sectors and go to a total shutdown, as either the purple level lays out when our hospital capacity is threatened, or like we did back in March. When we really analyze this, we know that this has an impact to all workers in Pickens County, and that we don't currently have economic support capacity for this level. We do know that shutdowns do work to curb virus transmission. So if our only goal is to curb that transmission, this would be an option, but the staff felt that the weighing the economic impacts, as well as the incidence rate, that this wasn't where we were going to make our recommendation. The second bucket of comments that we really heard were to stay the course and just continue to enforce the orange plus metrics. When we looked at this option, Enforcement alone is not going to impact the transmission of COVID that occurs in indoor environments. And so, although this option does protect service jobs, it doesn't address sufficiently curbing the spread of the virus. And so that brings us to the third option that we heard support for, and that was the red level measures and more capacity when we see improvement. So we know with the red level measures, we will see employment impacts to 1,200 service industry workers. We will share later today the economic support that we understand is necessary if we move in this direction. We also, when we're thinking about this, we heard that staying in red until we hit 700 and was a barrier for some community members and sectors to be able to support this. So that was why we really listened, and we heard that if we go into this, knowing that we're nearing 3,000 per 100,000 at our incidence rate, and not knowing how long it's going to take us to get down to 700, we wanted to be able to incorporate the 5-star program into this recommendation, because that allows, when we are seeing 2 weeks of sustained decline in our incidence rate, for businesses who have applied and been certified to be able to be operating. And so it meets that need from the community of knowing that businesses could start this as soon as we see a 2-week decline in incidence rate, but still really protects it protects that 700 incidence rate, which was really come at because we know it was set because we know that when we have an incidence rate that high, our contact tracing and box it in strategies, we can do all different corners of the box and contain the virus there. And we also based it on looking at, where when the governor made the move to move counties from red to orange, I think the average state incidence rate was even lower. It was about 500. And so we thought that 700 was still something that was within the realm of being congruent there. The last point here is that we've seen the red level restrictions decrease transmission of virus. We've seen it with all of the counties that did go into red back in November. It did lower their incidence rates. And so that's why we are still landing on the staff recommendation for those red level metrics, and with the addition of applying for the 5-star program as soon as possible. The next slide walks us through a timeline of this proposal. So here we are today on the 11th at the Board of Health meeting. The 15th, we would propose that the red level measures go into effect. The following week, the 18th, we would have our application for the 5-star program into the state. The 5-star program would then need to be accepted and approved by the state. Once that happens, businesses can apply for 5-star certification. And then we would continue to watch our metrics. When we have 14 days of declining incidence rate as measured by the state report card, we would be able to have those 5-star certified programs operate at the 5-star capacity. If our incidence rate continues to decline to 700, at that point, we would move back into the orange level of the dial. The next slide just again lines out the dates that the new public health order from whatever's decided today would be finalized and signed and posted tomorrow, with that effective date of Friday, January 15th. The next slide walks us through the 5-star program eligibility. So currently, these counties in the level red must meet the following criteria before being able to be eligible for the program. So it's again that 2-week sustained decline in incidence, a percent positivity under 10%, or the option for 10 cumulative days of decline in the previous rolling 14-day period. So basically, we're wanting to see a decline in percent positivity, a decline in incidence for 2 weeks, and then under 90% of ICU beds are in use, and steady or declining regional hospitalizations. If we were to be in blue, yellow, and orange levels, counties in those levels can apply for the 5-star certification as long as their incidence rate, percent positivity, and hospitalizations meet the thresholds and criteria of their respective dial levels. So if we look at the next slide, it's again, this is the 5-star program, and where we would be rolling into this would be in the red level. And so if we meet that eligibility that was just discussed, we would be able to operate at orange capacity levels for those businesses that are certified, while other non-certified businesses would continue to operate in that red level. Next slide. So again, this is the slide that shows some of the counties who went into the red level. All counties in Colorado who adopted these full red level restrictions did see a sustained decline in incidence rate. So I think it's important to note that these graphs that we're looking at, these are actual data. These are not projections. These are not models. This is what actually happened in these counties. And so because we see that this has happened in a number of counties, this is where we're drawing our conclusion that we have confidence that this would be, this is the best place to adopt red if we want to make an impact on our incidence rate. Next slide starts to go into more detail on these mitigation levels. So red level mitigation measures, close indoor dining. Red level mitigation measures allow takeout, curbside, delivery, or to go, and also allow outdoor or open air dining options with only groups of one's own household. The red level also includes an 8 p.m. last call. And then this final bullet is just to really define what outdoor dining includes. So any kind of outdoor seating without structures, or these temporary outdoor structures that have the following features: to non-adjacent sides that are entirely open from side to side and floor to ceiling. It could also look like two adjacent walls that are closed and two adjacent sides that are closed that don't have a roof. Could also look like ceilings, roofs, umbrellas, or canopies with no walls. Or it could be a single party structure that allows for ventilation between uses. One example of those are the igloos that are being used. The next slide shows some additional mitigation measures that we were able to reach out to our partners and discuss. So SkiCo has their own ski area operational plan that was submitted and approved by the state early on, and allows the ski company to work in partnership with public health to be able to adapt their plan as the situation changes in the county with regards to incidence rate or other measures. And so what we would be doing with regards to that plan would be to improve mask and distancing enforcement. That plan, any business in that plan is also affected by the level the county goes into. So there would be also no indoor dining on the mountain or with SkiCo associated restaurants. And then we would continue to monitor the capacity and implement a reservation system if that target capacity is exceeded, again, in accordance with what was laid out in the ski area plan. Next slide, please. For lodging. So lodging has already been restricted to the one household per unit. What would change is that on Friday, this would become universal. So regardless of when the reservation was made, it would be only one household would be permitted per unit. We would be looking into accountability for both the property management company or hotel or lodging facility who makes the reservation, as well as the customer who is coming, the patron who's staying in that unit. Again, we continue to monitor capacity. From all the data that we see, it's looking like capacity is only bumping up to maybe 40% of what we have locally. And so if it looks like that capacity would be exceeding 50% occupancy, we could consider a capacity limit for lodging. Next slide, please. Kurt, I believe this slide is for you.
Thanks, Jordana. Yeah, can you hear me? Yep, thanks. Okay, so one of the other pieces that we continue to talk through is enforcement. And with the limitations we have around enforcement, we still want to look at our processes. In discussing some of the opportunities for enforcement last week, the idea of looking at a model like open space and trails and being able to have some staff take on the enforcement ability came up. So I reached out to Gary Tenenbaum with Open Space and Trails just to talk through what their process is and their authorities are with that piece. So, and then as we work through what that looks like, the staff came up with a couple of ideas around where we might be able to utilize this capacity, depending again on what we find out. Lodging capacity, again, that one household piece, and the traveler affidavit, again, not necessarily looking at being at the airport, but looking at other opportunities where we are a little less resource intense, where we might be able to identify that issue and take enforcement. Same with quarantine and isolation orders. What can we do there? And then household gatherings, which is something that comes up. And again, that would be a big one with looking at partners as well around getting information around household parties, because as Jordana has pointed out, all of us are not getting invited to any of these parties to know about them. And so there's going to be this piece around information that either from our local law enforcement or others that we'll need to look to. But again, those are opportunities depending on, the conversation that we have around this idea of internal enforcement. Thanks, Jordana.
Thanks, Kurt. Go to the next slide. The other point that was brought up over this kind of engagement period was some options for increased communication. So a question that I think we'll need to go through with the Board of Health is there were some requests to report outbreaks either in aggregate more predominantly or with the business site or name. So we've had this discussion before, and the conclusion we've really come to is that reporting the business name or the site at which the outbreak is happening in a very predominant way, by the time that it's come to our attention, we're working with the business. We have taken, the business that has working with us has taken the measures that it needs to address the outbreak. By the time that gets posted and promoted, it's almost, it's not helpful information to be able to protect anyone, because by the time we get word of it, we have addressed the spread and the cause, and are taking measures to address it. Some of the thought is that, if you post where the outbreaks are, people are going to feel that if they're not going somewhere with an outbreak, it might lend to this false sense of safety, when really that's not indeed the case. We can post in a more predominant location or in a different format if it's helpful to the community. Outbreaks in aggregate, that does go out in the daily report that we have typically been sending to the Board of Health, our elected officials, our schools, some other folks in the community. And there's been the point that if that is data in a format that the community would find helpful, we can also post that daily report in a way that's accessible to the entire community on our website. This other issue that has been raised is, can we report citations and enforcements, again, in aggregate or with the business or site name? We currently also have a report that goes out to that same group of our Board of Health and town managers, elected officials, schools, with that information in it. Again, we can make that public, or if there is additional benefit to reporting our warnings and notices of violation and closures that call out the specific business or site name, that is something that's an action that we can take. Additionally, making this move, we felt like it would be important to be able to do additional communication from our comms team around how to support local businesses, promoting takeout. You know, I know the town of Snowmass is promoting their gift card program. So what are additional ways to be able to help support businesses who this pandemic has been incredibly difficult on, as we're all working towards these shared community goals. Additionally, we can share the CDPHE report card. They update that twice a week for Pitkin County. And that shows us where we are with regards to declining or increasing whatever our incidence rate is doing. It runs 3-day averages, and that would be the measure that we proposed to use for when we're able to either be, well, it's the measure that CDPHE uses to say when we would be able to apply and be eligible for the 5-star program. And we could also use that for when our incidence rate has been declining for 14 days and is below, hits at least 700 to move us all back into the orange. Finally, we recognize that the communication around economic support available, you know, we know many businesses have been continuing to be hampered by the reduced capacity rates, but that this move in particular will affect, you know, those our 1,200 employees in this service sector, as well as the businesses, and that we would be doing our part in communicating the available economic resources. And John, I would turn it over to you at that point, at this point, if you've got a couple more details to provide with regards to the economic supports.
Thanks, Jordana. Yeah, so right now, our Human Services Department is finalizing a worksheet to be distributed for individual support. And we've also been distributing information on business resources. I will just highlight a few of those real quick. My cat has erased my presentation twice already. On the business resources, of course, towards the end of December, there was $284 billion appropriated for small business relief through the federal Paycheck Protection Program. The applications for that will reopen the week, actually today, this week, January 11th. And they're going to be separated into first draw and second draw loans. First draw will be for those who have not previously received Paycheck Protection Program loans. Within that legislation, expenses that can be forgiven or loans that can be forgiven have been expanded. There's also a shuttered venue grant program through the Small Business Administration for both private and nonprofit groups that have had venues that have been shut down through public health orders. And then, as we talked about last week, we're working on rolling out a local grant program that the county has appropriated $1.3 million. We're working with Aspen Community Foundation this week to finalize hopefully the application process and terms of that program. We'll look to get final board approval on that next Tuesday and hopefully roll it out next week. In terms of individual resources that are available in December, along with the congressional appropriations, unemployment insurance benefits were continued expanded benefits. There's an additional $300 unemployment benefit that will become available here this month. It will run for 11 weeks, and so really through March. There are stimulus check payments that are scheduled to start going out, I believe, later this week by January 15th. Those are $600 per qualifying adult. And then we'll be distributing information on county programs, temporary assistance for needy families, as well as the many nonprofits that are providing emergency assistance, such as Aspen Family Connections, Family Resource Center, Roaring Fork Schools, Catholic Charities, the homeless shelter, and Valley Settlement programs. In addition to the dollars that were appropriated for local business support by the county, we did also appropriate additional funds for nonprofit support, particularly for those nonprofits that are providing emergency financial assistance. So we have another $400,000. I was just on a call with representatives from that group prior to coming to this meeting. And we're talking about the best ways to distribute that through our human services funds so that those agencies are ready for any additional calls for help that they'll be receiving from families and individuals. We'll also be promoting the Property Owner Preservation Program, which is federal dollars that are coming through the state that allow landlords to register and receive help for tenants that are having difficulty paying their rent so that they can stay in place. And then there's also a program for employee assistance housing funds through the state that we will also be looking at. And then of course we have the county programs, temporary aid for needy families, as well as the low income energy assistance program to support folks. And then finally, as we've talked about before, NAM presented last week, we continue to work with and support food assistance programs, whether those be county programs like supplemental nutrition assistance programs, Lift Up, and mobile food pantries. So I will go ahead and stop there, but we are mobilizing and preparing for increased demand in all these areas.
John, it's Marky. Thank you so very much. It's so important that we began to clearly outline resources that would be available to employees as well as employers. That's going to be a critical component of moving perhaps into this red phase, which has been outlined by staff. But John, I don't know the answer to this one. And I would look to two municipalities, Snowmass Village and Aspen. We know we had record level of real estate sales this year, which produces rent. It's almost unbelievable how much real estate has really been sold and how much money is coming into each one of the municipalities. I would ask our mayors of those two communities if there were any way that we could, through an emergency order or what have you, pull some of that money into additional assistance program for our local communities, particularly the employees who are really going to get hit with not having enough, perhaps, money to meet all their needs on top of these other programs. And if that's even possible, I'd like to recommend or even think about how that could come into the Pickens County Fund that would be administered accordingly. So I'm just throwing that out there. I don't even know if it's plausible. We're not going to spend any time discussing it, but I'm just looking at other opportunities to help our folks. So with that, any comments? Okay, if not, Jordana, did you want to take questions from the board on the program now or when we get into after the public comment?
It's up to you, Marky. If we go to the next slide, the next part of their agenda is the public comment, but I'm happy to answer any questions if there are any now.
Okay, board, I'm going to ask if you have any questions for Jordana with the presentation that has been provided. I have one for Kim Levin. Hi, Kim. On today's report that just came out before we started the meeting, it looked that the ICU there at Aspen Valley Hospital has 2 new patients. Is that correct?
Yes, Marky, thank you. That is correct. Of our 4-bed capacity in the ICU, there are 2 that are now occupied by COVID patients. And I wanted to make the point, they're young, in the 40s, 50s, and so we are seeing this. And I do feel that this is very significant information in terms of our overall data of the day that we are seeing a rise.
Thank you. Other questions for staff? Jeannie.
So Jordana, if with all these cases, I predict that we will get a lot of ICU patients and we will have 3 admissions in one day. So if we don't go into the red, we will meet the criteria to go into the red very soon. And if we do that, then we will have to close, but we will have to go back to 350 as a threshold instead of 700. Is that correct?
That is correct, Jeannie.
We definitely don't want to go there.
Yeah, Greg.
I saw Tori had a question. I just wanted to alert you that he had one. I do have some, but I see Brent and others have hands up, so I'll wait.
Okay, I'm going to scroll across. Tori, do you have a question or comment?
Thank you. Yes. Was wondering about why we would need to apply to the state for the certification program. Why can't we start doing that ourselves? And I guess, let me frame it in this sense. I see that the recommendation has an effective date of, I believe, this Friday. And I think that's been given with some deference to businesses and making preparations for that. My question would be about us moving into no indoor dining sooner, but start a certification program sooner.
So the 5-star program is viewed as the state as a variance to any county that applies for it is essentially applying for a variance to follow the 5-star program. So that is just a required step of the 5-star program, Tori, is to apply to the state. They have to look over, how we have outlined our program and approve it. And then once they approve our application, we can begin operating, we can begin certifying businesses locally. And then after that, we have to continue to wait for our incidence rate and hospitalization and positivity to be on the decline for 2 weeks before businesses that are certified can reap the benefits of operating in those orange levels of capacity.
So again, so I would, and hearing new numbers from even today, and moving us towards red level categorization, which we're not in right now. Currently, we are in our orange, and with our added restrictions, we're in orange plus. So again, I'm just wondering why we wouldn't just start that kind of program here in Aspen if we're talking about, there's some places out there, for example, the St. Regis right now is doing all employee testing every 72 hours. There are restaurants that are operating under the orange level and not having incidents there. But again, I'm really advocating for getting the guidelines in place that are allowing in other communities and other counties the ability to operate with indoor dining with those with new restrictions in place. So I'm just wondering why can't we start that now? Why do we need a state program for us to start putting some of those metrics involved that are being utilized in the certification program? Why can't we just do that? Why aren't we operating or taking out some of the people that are not qualifying for that certification and having some places operating under safe restrictions?
So I'm not sure if I completely understand your question, Tori, but I can state that we do in our Orange Plus Plus, we have already required some of the things that are required in the 5-star program. So taking reservations in the restaurant setting. There are other examples of, we've required that only households are permitted to dine together. Some of these other measures that we've already attempted to implement. And then I think to your point about the testing procedures or the screening, using testing as a screening mechanism. We can definitely continue to work with businesses who are interested in that as we have more capacity. But I don't think I'm quite clear on your other question about why we can't do that now.
Can I take a crack, Tori? Because I think I might. I think what you're asking is, why can't we implement a program, and if businesses are abiding by the requirements of that program, they can remain open at some level. Is that kind of what you're asking? Like, why can't we just stand one up now? Why do we need state approval for that purpose?
Correct.
So I think there's two factors that staff was looking at. One is rolling back or restricting activity levels to reduce contacts and drive our incidence rate down. And so one of the things that the 5-star program has is that before businesses, certified businesses, so we could start the certification program sooner. That is true. But the difference is waiting to let businesses operate at a higher level or stay open until we've seen a declining incidence rate for a 2-week period or more. And so what you're looking for is that curve to start to bend down instead of going up. It is one aspect of that 5-star program. And I think from staff's perspective, what the 5-star program did was it provided a way for us to allow activities to resume before hitting those hard numbers of 700 or such that staff had put in, but that we're seeing a trend in the right direction. I don't know if that answers your question.
It does somewhat,
Can I answer one more side of your question? The other advantage of being qualified in the state program is that if we are moved to a higher level in the dial or we qualify for a lower level in the dial, those businesses that then are in the state certification program get to operate under lower restrictions, even than what would typically be required by the state. And so if we're going to go through this effort, it makes a lot more sense to be certified with the state so that our businesses can enjoy those benefits once our numbers get there.
Thanks.
Sorry to interrupt. I just wanted to answer that second part.
Greg?
Yeah, I want to get some clarity on that, John and Tori, if you could just hang on this topic. What I thought I was expecting from Tori was, if we start sooner, we can finish sooner, and maybe finish soon enough to get back in business for the busy season. What I'm hearing is we have to go through the steps for the state, and it's going to take as long as it takes to get us there, which is the schedule that Jordan has outlined. So as my question is for Tori, is that what you meant? Is there any way we could start this sooner in order to get into it sooner? And the answer sounds as if that I think we can't go on a tighter timeline than we've already established. Is that right?
Somewhat. I hear the end goal as being part of the state certification program that was outlined by the state for those counties that were in red level numbers and data-driven metrics. And so I'm hearing that we want to get to that, and I'm just wondering why we would delay. Why wouldn't we? For example, again, we could go to no indoor dining starting tomorrow and get restaurants that want to get back open. We could be certifying them through our county process. We don't need the state to set up. We have the guidelines that have been issued by the state, so we can be implementing those here, along with other avenues, like I said, like testing. I mean, you could have there are the antigen tests that are available. They can be administered and results within 10 minutes, 15 minutes. I'm just wondering why we're not moving towards that closure and then the certification for places to operate at orange level restrictions as we are now through a certification program that we could be doing here in our own county. So yeah, in some ways, Greg, I am talking about trying to expedite this so that we can, get these other guidelines in place and that we can have safe operators open. I just have a concern of public health and safety as it comes to a closure that may be by our own metrics that we're setting up may drag on for weeks when we could be implementing some of these restrictions now and operating safely now, or in a couple days, or next week. I mean, but if our goal is to get to a certification program, we can do that.
Well, the staff are the ones that have got to write the certification program, and a county just can't develop their own certification program and enact a certification program that's not in accordance with the state guidelines around certification programs.
But we kind of could, Marky, because by state metrics, we've been requested by the state to be in red level restrictions, but we have not. And again, like I agree, the incident rate is so high that we're looking for more opportunities to reduce transmission. I'm all for that. I'm just saying that if our end goal is to get to operating safely, we can get there. We can do a certification program unto ourselves here. So again, that program was started for primarily for those businesses or for those counties that were in red level metrics and restrictions. And so I'm just wondering, we are actually not there. We're close. We're getting there, but we could put in these restrictions ourselves. I still am kind of wondering why counties were moved out of red and into orange in mass in a bulk move by the governor and the state. So I'm just wondering, we could move there quicker, I think.
So, Tori, I think as a Board of Health, you could, I think staff's recommendation, and when you saw 5-star programs stood up, for example, in Summit County or Routt County or some of the other counties, it was for those counties that had seen a 2-week decline in their incidence rate. So while their incidence rate didn't come out of the red, which is, we're suggesting the same thing. We have not seen a 2-week decline. In fact, we've seen a 2-week rather large increase. And so what we're suggesting is we go ahead and get the certification program in place, but that we not open back up until we've also seen that 2-week decline. And that's what seems to be working in other communities. From a policy perspective, you're right. The Board of Health has those options in front of them. But Jordana, I think it's staff's recommendation that really part of our problem is the incidence rate. And when the incidence rate is this high, indoor activities continue to present a high risk of transmission, even when restaurants and retail space, all these different venues are doing the right thing.
Okay, I'm going to see if there's any other questions from the board, because we will come back around to questions for the staff in terms of the recommendations. But do I have several more? Yeah, Linda, your hand went up. I'm sorry, Brent, your hand went up ages ago.
Oh, that's all right. Yeah, just a couple of comments, and that is that this is all hearsay, but I heard of a 17-person New Year's Eve party that produced something like 8 positives out of this one party. Kim would probably know, or Dr. Levin would probably know the reality of that number, but if it isn't true, it's probably almost true in a few other places, which is a concern we've had right from the beginning, which again goes to enforcement. And I just wanted to ask staff, have they had any consideration of, this isn't overkill at this point, as far as I'm concerned, and that is pursuing reckless endangerment. That's a term in law. And when you knowingly break the law and endanger other people, that's almost a prima facie evidence case. Now, if nobody got sick and you had a 14-person party, maybe the district attorney would be, like, geez, just doesn't want to pursue it. But when people get sick, their lives are in danger. And as you said, half the people have these long-term COVID effects. So that's the question. That's one question about whether this either has been discussed about pursuing this thing more legally in terms of enforcement, because it's a pretty broad umbrella. And then also that I do think the idea of making the public aware, and I think the public has a right to know where the outbreaks are. And we don't want to be unfair to certain people, but on the other hand, the facts are the facts. So thanks.
Okay, Tom?
I'd like to point out another measurement parameter that might give us an earlier clue. I went to the CDC website recently and noticed that they're using a 7-day moving average. And then Johns Hopkins University popped up as well as New York State are using a 7-day moving average. I'm not suggesting that we only use a 7-day moving average, but if you use a 7-day moving average in addition to the 14-day, whatever program is adopted, we might get an earlier clue of how we're moving from using that parameter as well.
Thank you very much, Tom. Good suggestion. Linda, and then I see Bill Mattson.
My question is for Jordana. I wondered if you took into account immunization vaccines and increasing the numbers immensely, because I think that all of these measures are going to be very helpful, and I appreciate all the thought process that goes into it. However, I think that ultimately what we want to accomplish is going to be accomplished through immunization and mass immunization. So that's my question.
Yeah, Linda, we still have a huge priority for getting our community vaccinated as quickly as possible. I think that in the initial period of time, in the next weeks, months, where we will have the ability to have our most at-risk healthcare staff protected with immunizations, and then working on down towards those that are 70 plus. But as we know, this virus continues to affect folks of all ages. As Kim spoke to, who's in the hospital right now with folks that are 40 and 50. We are not going to get, as our incidence rate is climbing, the vaccinations that we're able to do in the community aren't going to have, to be able to take effect, to have any impact on that incidence rate and who is going to be continue to get infected. So in the long run, vaccinations and what percentage of our population is vaccinated is going to come into play with the measures and how we loosen up and what the dial looks like as we move there. But in the short term, that's not something that is really going to affect bringing our incidence rate down any faster than using these other tools that we have seen work in other counties.
Linda, you're muted.
I understand that. I think that there should be a real push for mass immunization in our community. I think that we need to ask for a lot more vaccines and really open it up to everyone for a long period of time and increase the numbers and decrease the incidence by mass immunization.
Yeah, that would be absolutely ideal. The way that vaccines are being distributed are on a per capita basis. So they come from the federal government to Colorado based on our population in Colorado. And then they come to our county based on our population here. We are happy to announce we have received 1,000 doses for our 70 plus population next week. So we are this week, it's already this week we are working through that, and we are able to put vaccines into arms as soon as we receive them locally. We are just waiting on our allocations for the states to be able to achieve that, and I agree 1,000% that is an enormous priority of our public health department.
Thank you very much. Bill?
Yeah, thank you. I just want to make sure that we're following the statistics. I think we're all, victims of hearsay and innuendo, and I just want to make sure that we're looking at the numbers. And I think to Jeannie's point, we don't want to get to the point where we have to reach that 350 threshold before we can come back out of it. But does the 5-star program allow us to come out of it without hitting that 350 threshold?
So the 5-star program allows businesses who are certified through the program to begin operating at the orange level capacity as soon as we have seen a 2-week decline in our incidence rate number. So that could happen even before that we hit 700 incidence rate number.
And I see another hand, and that's Ann's. And then from there, I'm going to open for public comment. Ann?
Okay, just to follow up on Linda's comments about the vaccinations, 2 quick points. I think we can make an argument for asking for more vaccinations. A couple of things, the fluctuation in our population going from 6,000 to maybe 12,000 over a weekend. It's not the norm. It's something unique to the resort towns. Secondly, if and I may be mistaken, what I'd heard is it's based on the census. I'm assuming it's the 2010 census, and Colorado has grown tremendously since 2010. And lastly, if there's an argument that we are the second worst in the state, maybe we need a little more assistance. The other comment is if we could work towards more efficient administration of the, not administration, but vaccination. You see samples across the country, different things, drive up, large area vaccination sites, that kind of thing. If we could start working on getting more people through more quickly. Thanks.
And I really don't know what that whole process is. And that's a very good point. And Dave Ressler just turned on his screen. He probably has the answer to that.
Well, I didn't realize it was quite that obvious. I just thought I better show my face. So Jordana mentioned that we ordered and requested 1,000 vaccines. We expect that number could actually be higher, closer to 1,100 that we'll be administering this week. That is a function of the extra vaccine in the vials. But we'll know more as we administer those. But to your point, your very good point about the efficiency of the administration, I can tell you we are administering them as fast as we get them. So to Jordana's earlier point, it really is a function of supply, but we are going to be seeing some new processes this week in terms of, it'll be the largest number in a couple of days that we've accomplished. And so the incident management team for Pickens County is provided the support for the logistics. That's what they do really well. And so we're providing the staffing support, and we'll see how it goes, but we have very high hopes based on how smoothly everything went on Saturday. We administered about 120, I think it ended up being, doses on Saturday, and it went very well. But obviously this will be a whole new scale. So your point is very well taken. We will make sure we do our part to partner with Pickens County to ensure that every dose gets into an arm just as soon as we receive it, so we can go back and get more and keep the process rolling.
I would just add on to that. Thank you, Dave, and thanks for the partnership with AVH, but, or not but, and as we've been planning through our IMT, you know, we've really focused on scalability so that we can quickly respond if we receive more vaccines than expected. And to your point, Ann, we have made the case about our population, and the state has agreed to consider a higher population number. It's just such a small, it amounts to such a small percentage when compared against the whole state population that when vaccine numbers are limited, we're probably not going to see a big impact from that. But as vaccines become more available, we'll start to see that influence. So we have been making those arguments on behalf of the community, and we are doing well, not only in advocating for the vaccine, but to Dave's point, as soon as we get them, getting them in arms.
Great. Thanks, John and Dave.
Okay, I do need to move towards public comment.
Marky, yeah, I have to run in to see what Tommy's status is, but I just want to make a really quick comment and I'll try and come back. But this is kind of an in general. I just think in the board's making this decision, we need to take into consideration the position that was so well made by Snowmass Village. And I'm thinking I haven't really seen the final position of the city of Aspen as to the effects of closing restaurants, because those are the two jurisdictions that have the restaurants for the most part. Pickens County just has, you know, unincorporated Pickens County, very scattered. So I think when the board's making that decision, please take to heart that the hard work that's been done by our municipalities in submitting comment to try and give some consensus based on the elected officials' positions. And I'm going to run, but I will try and come back as soon as I find out how Tommy's doing. Thanks, Marky.
Thanks. Okay, from here, we're going to take public comment. And the way...
Sorry, Marky, go ahead.
The way public comment will occur today, each person who wants to speak will have 3 minutes. And of course, you'll have to raise your hand. 3 minutes and 30 seconds before your 3 minutes are up, you will hear a ding. And when the 3 minutes is up, we will mute you. Is that correct, Suzuho or Jordana?
That's correct, Marky.
Okay, there are over 1,000 people on the call. So with that said, I will mute myself. And Suzuho, do you want to run the public comment or?
Yeah, we actually have Raleigh and Lindsay who are going to be helping out. And I believe for folks on the phone, it is *8 if you want to raise your hand. And then for anyone on Zoom directly through your computers, you can raise your hand on the bottom Zoom panel, and then Raleigh will call on folks.
Okay, we will, when you come on, please state your name and how you're connected to this conversation. If you're a local concerned citizen, that would be wonderful to hear from you as well. So with that said, I'm going to mute myself and then turn it over to staff to conduct the public comments.
Thanks, Marky, and thanks, Suzuho. Just for callers, I believe it's actually *9 to raise your hand and then *6 to unmute. I'll be going in order. So Jimmy Yeager, go ahead.
Hi there. 3 minutes. Okay, I'll be fairly quick. First question for Dave or for Kim. Is it protocol at the hospital that any COVID patient that is admitted is first admitted into ICU because of the negative pressure nature of the rooms? And so an ICU patient doesn't necessarily reflect the severity of their admission?
Yeah, I can let Dr. Levin speak to it as a physician, Jimmy, but for operational purposes, you're exactly correct. We are, as much as we can, we keep our COVID patients in the ICU on what we call a patient care unit status to take advantage of the negative pressure.
All right, I know I got limited time, so I just wanted the clarification on that. Kim, I'm sorry, but I just want to ask, we have a lot of faith in our epidemiology department, and on the 7th last week, it stated in the report that the projections on the curve of our incident rate was not made beyond January 16th, this coming Saturday, because if cases trended as expected, I'm quoting, to a high of 400 to 500 cases in a 2-week period, which is what we're seeing, cases may begin to naturally decrease at that time as the number of susceptible persons will be limited. Okay, so the chart that we are looking at as a community does not show a downward trend after this weekend because, why? Because we chose not to include what the expectation was. When this report was written, everything that they thought was going to happen has happened. We've seen this large spike in incident rate, and based on the epidemiologists, they expect a natural decline starting this weekend, mid-January, to start to happen. My question to everyone is, why are we not waiting to see if the information provided by our own team is correct or not? Because the ramifications of closing restaurants go well beyond the 1,200 employees. It's 12 to 1,500 employees. There's services, supply chains, et cetera, that go along with it. Our biggest fear as a community is how do we get back out of it? Now, sure, if this is true and we see the incident rate go down for 14 days continuously because it's a natural decline, we are just hoping that it's not blamed on the fact that we closed restaurants, because it's already been predicted by the county's epidemiologists that this may be the case. Today's Board of County Commissioner meeting was a split decision, and Greg can speak to this later, but it was very clear to me that Francie and Patty were in favor of keeping restaurants open. Greg and Kelly for certain, were in favor of more blunt measures of restricting restaurants. And Steve spoke more to this, let's wait a week and see if this comes true. If we have a natural decline, why are we doing this now when it's already been predicted by our own epidemiology team? I believe that's probably.
Hey, Marky, that was 3 minutes. Let me know if you want Jimmy to finish up.
Now let's move on.
All right. right, next we have Susanna Lee.
Hi, Susanna and my partner Isaac from Aspen COVID Testing, the new COVID testing operation that opened this month in Aspen.
Thank you for the opportunity to speak. Before we make a few brief remarks, I just want to appreciate everyone's efforts to keep the town healthy and to mention that we've conducted nearly 3,000 tests in this community in the past 3 weeks, and we are nowhere near capacity. We could easily do 600 or more tests per day if called upon. I can't help but notice that no peer-reviewed research was cited on this call, and when the stakes are this high, I just hope that our decisions are empirically driven and we're taking every opportunity to learn from others' success. We're discussing punitive measures with uneven impact and using the bluntest tools in the drawer. Broad-scale shutdowns were used in the early stages of the pandemic, but our knowledge and tool set has greatly expanded since then. If you send people home and back to their communities, we now have no clear way to verify their status before they return to work. Programmatic testing works, and it has been repeatedly proven to reduce positivity rates to 1% levels without shutdowns. After the shutdown, the only way to keep cases from rising again is with testing, so let's not wait. Let's create a bespoke program for this community today that includes testing and give businesses a responsible framework to get and stay open. I couldn't agree more with the comment about mass immunization, and while we wait for the vaccine to be fully deployed, let's mass test to keep infections low in the interim. Aspen COVID Testing is prepared to launch a mass testing program for all the workers you've discussed today, and we can launch it this week. Within days, all the positive cases, the majority of whom are walking around asymptomatic and unaware, will be removed from circulation and unable to start further infection chains. What we've already found, first round testing removes folks currently positive. Second and third round removes anyone who's caught the virus from them, but took a couple days to develop symptoms. Bold, decisive, and effective action is what we need. We cannot tolerate missteps or delays in an exponential crisis.
And just to speak to that, we are doing this at, as much at cost as possible. We're here to support the community. Our goal is not to drive revenue and profit margins on this. It's to come up with a solution that works for us and works fast. We're doing it at the St. Regis. We have over 310 employees in our testing program there. As all of you know, they were one of the first sites in town to have a real outbreak, and they contained it so quickly. The first day we were on site testing, we pulled anyone who had become symptomatic from exposure. They originally got tested, I believe, through Aspen Valley Hospital. That first round of tested pulled people that were infected. The second round pulled anyone that caught it from them. And after that, we've had 0 or 0.5 percentage point positivity rates daily.
We're ready to go when we hear the call. Thank you.
Next speaker.
Thank you. And before we move on, Susanna, do you mind repeating your affiliation and the gentleman who is also speaking as well, their name?
Yeah. So we opened a site called Aspen COVID Testing. We have a retail location across from the Aspen Art Museum. But again, we're creating bespoke programs with employers. We're working with over a dozen employers right now in Aspen. Our business is also Rocky Mountain Labs and Aspen Laboratories. So a few different names have floated around.
And I would just describe our affiliation as we are Aspen residents and concerned citizens that were so concerned we opened a testing center and lab.
And a full diagnostics lab, CLIA certified lab, so we can result PCR here in Aspen.
So the question was, what is your title?
Yep, we're the owners.
Okay, thank you. Okay, moving on to the next.
All right, next we have Isaac.
Hi, I'll yield my time. Sorry.
Moving on.
I apologize if there's some dogs barking in the background. Mark, please.
Hi, yes. My name is Mark. I'm a renter this season in Aspen. And wanted to bring up a few points that I think some were touched on by other folks on this call already. I spent a large part of the pandemic over the summer in New York City, where my primary residence is. And I guess I've seen them handle things a bit differently and wanted to kind of bring up some points that I think are worth looking into before making a wide sweeping decision around indoor dining and further restrictions to the economy. One of which the gentleman and young woman ahead of me also mentioned was peer-reviewed statistics. You know, one of the things in New York that recently came up was the results of a contact tracing study. And for a city our size, it was seemingly shocking that only 1.3, I believe, % of cases were tracked to indoor dining that was properly spaced and was acting in code with what the restrictions were. I'm curious what the numbers are for Pitkin County, specifically in Aspen or in Snowmass Village, where those restaurants are, and if that's actually been looked into. I think along that line, I was surprised by some of the earlier dialogue around New Year's Eve parties and things like that, where private DJs are still able to be hired to residences, bartenders are still able to be hired to residences, when we're actually looking at shutting down properly spaced out businesses that allow for responsible dining and responsible partaking in eating and supporting business. I would think the first step would be to look towards people violating the party restrictions by hiring these individuals that don't necessarily line up with a method of responsible gathering. And I think the last is the holiday timing. And I think, with the restrictions on the affidavit to get tested before you come in, I did, friends that I've seen this season have. I don't see that being enforced across the board in terms of requiring to see test results at hotels, driving in from Denver, coming in through other means other than the airport. I don't see people getting asked for those test results. I think that would be a step in the right direction. And to see if the curve from the holiday comes down while preventing it from staying up and looking at these negative test results, I think that would be a more responsible way of going about it than looking at shutting down responsibly spaced and limited capacity restaurants. I want to thank you guys for your time as well in explaining this and going over the numbers.
Okay, next speaker.
We have Dan Carroll.
Hi, I'm a renter for a vacation coming up here in the next week, and it's for me. We're 3 couples who've planned to come and to get tested before we come, part of your mandated restriction, and it seems like if we're getting tested, we're all from 3 different families staying in a condominium. It seems like maybe you could mandate having a rapid test. And the reason I say that, because the owner of the property is not willing to reschedule or refund my money because part of the VRBO contract, I made the rent under my name. So I have about $7,000 at stake here because of this potential limit and the mandate for us not to occupy the condominium, even though we're tested. How can y'all help us? And the property owner is probably going to be struck pretty hard because she doesn't get the rent from these potential people who are coming to this 3-bedroom condo that can probably sleep up to 8 people. So that has a certain economic impact. Plus my loss. What's the recourse for that? How can y'all help us? I think the rapid testing is a great thing. They're doing it at airports, people coming in international to airports in Atlanta, coming from London. They get off the airplane. In Amsterdam as well, they get tested before they get on the airplane, they get tested when they get off. That way you've got, some economic activity and people who are walking around that know that they're COVID free after that instant test. Thank you.
Thank you, Dan. Which community are you talking about?
The community that we're scheduled to be is in Aspen, Pitkin County, and I'm in the community of Hamilton County, Tennessee.
Okay, thank you very much. I would ask the board to take into consideration of Dan Carroll as we make decisions here. Okay, next.
John Sharpa.
Yeah, I assume you can hear me. Thank you. Question is on the lodging, if you do the 50%, like the previous caller was saying, I would highly suggest the board consider not requiring people to cancel if they've already booked. That would be particularly important during, for instance, the X Games weekend when a lot of the sponsors and the participants have already booked. So it would be awkward at best, and I think economically challenging to call a bunch of people and tell them, sorry, you don't have those rooms. So I would highly encourage you to look at that component if you go to the 50% level. And I'd also ask you to consider doing that not so much on a daily basis, but on an average basis, let's say a week or something, because still there are spikes where a lot of lodges will be over 50% for a day or two, but under thereafter. So just things to consider. Thank you.
Thank you, John. Next.
Martin Swanson.
Hello.
Hello, we hear you.
Whoa. Have a business in Snowmass Village bringing anesthesiologists to medical conferences at the Viceroy. This year, we're doing a virtual conference, having everybody stay in their hotel room or condo. We are getting, well, basically every single person asking the question, I will be vaccinated before I come. Do I still have to take the test? And I did find on the Pickens County website that in the frequently asked questions a couple of weeks ago that you were going to change the affidavit so that you do not have to have a negative test if you have had the second round of the vaccine more than 2 weeks before traveling to Pickens County. It looks like that has changed, but when these people booked, they were under the impression that they were not going to have to get tested. And now, do they have to get tested? I'm getting all kinds of frustrated calls from people who come here every year. And a lot of them they're just leaning towards canceling. The goalposts keep changing, everything keeps changing. They're getting frustrated with the whole situation. And I hope that they will understand and try to come back next year or the following years, but we're just not sure. And again, to one of the other comments, what happens with cancellations if they can't get their money back? Who takes care of all these financial issues as well? Thank you.
Okay, thank you very much, Martin. Next person.
Yes, thanks, Marky. Before we head over to the next person, I just wanted to read a comment that we did get from Jeannie saying indoor dining in New York City was shut down December 14th, 2020 until further notice. This is why there are so few restaurant-related outbreaks there. Just for everyone's situational awareness. I will be calling on DJ next.
Hi, can you hear me? Can
Yes,
you hear
we
me?
can. Yes, we can.
My name is David Johnson. I own two businesses. The one in Pickens County is in Redstone, retail business. There's a lot of talk these days about fact-based policy. I think nationally, too much COVID policy has been fear and hysteria-based policy. We, like a lot of people this spring, I'm almost certain COVID is what I had. Everyone told us in Colorado, don't get tested in March and April. save the tests for the medical professionals. When we hear numbers like the rise in cases in Aspen, we don't have a benchmark to compare it to when so much COVID was so rampant last spring. And therefore, we allow ourselves to be carried away by, this rise in numbers. And everybody talks about how bad that is. And what we're not looking at, if we have 300 cases and 298 of those people have very few symptoms or they're minimal and they beat them, including 70 and 80-year-olds that I know, and they get over it within a week, we should be saying, great, 298 people just beat this and they're immune to it. But no, it's all about fear and hysteria and shutting everything down all the time anymore. And we can't sustain doing this. We can't just keep prolonging people beating this by shutting everything down being our answer. And, Markey brings up a point that maybe real estate sales monies could be used to provide relief. Everyone keeps talking about handouts to businesses and closing them down. We don't want a handout. We want to stay open. If I own commercial property in Redstone, if you're going to shut us down again, all us commercial property owners, then why don't you tell us we don't have to pay your obscene property taxes? It's ridiculous what we pay, especially in rural Pickens County, where we've been getting cheated for years. And so my property in Redstone, I live in, it's commercial residential. I've had 8,500 people walk into my home. I'm still here. Imagine that. The hysteria talking about enforcement from Pickens County open trails, people wearing masks out in parks and on trails, that's Stalinism. It's ridiculous. Every single one of you people I see on my screen, you walk into City Market, you've been exposed to it. You guys have beat it already. Where's the scientific measurement of that in our policies? We're not getting it. You want to put money into this problem, give everybody a free antibody test and base your policies on that.
Thanks, DJ. That was 3 minutes. Excuse me. The next individual will be, they're labeled as Old PC.
Hi, this is Bettina Slusar and Dan Goldman. We are residents of Snowmass, and we have two different things to say. We'll do it as quickly as possible. Just in response to the last speaker, I feel your pain. However, I think there was a really interesting article about what's going on in LA County right now, where there are literally 0 beds left because people are, as the doctor there said, suffocating. That's what's happening. So it is great when we get to beat this, but there are a heck of a lot of people out there who aren't beating it. And I think that we as a community owe it to humanity to take that into account.
This is husband Dan. I wanted to kind of note a couple of things. One is about 10,000 people a year die in drunk driving accidents. We're doing that countrywide right now with COVID in about 3 days. We've got hospitals overwhelmed in LA, and our incidence rate, which is one thing that's kind of constant, doesn't really affect how many people you're testing, how many asymptomatic people you're testing at the school, whatever else, is wicked high. I mean, we're not 50% over, we're running like 800% over. We have community spread run wide. Another thing I'd like to just to highlight, my dad died on Thanksgiving in St. Louis. We did not go to his deathbed or to his funeral because the CDC recommends against travel. Why are we not following CDC recommended guidelines against non-essential travel? Thanks.
Thank you. And also thank you guys for all you're doing.
Yeah, I that's pretty dramatic stuff. I will say on a slightly lighter note, when you guys signed up to be on the Board of Health, I am sure making lives and livelihood decisions like this, no one should have to do this. It stinks. And I am a huge supporter of a 2% transfer tax on real estate transactions, maybe $5,000 on private jets, and use that to subsidize payroll. We are the best of times and the worst of times right now. And Aspen is unique and a leadership kind of place. We could really try and step up and show the country what a creative community like this can do to protect lives and livelihood. Thanks.
Thank you.
All right, thank you so much. Lindsay Leatherman. Lindsay, are you on? Lindsay Leatherman.
Thank you so much. I'm so sorry. Is it possible for me to hand over my time to someone else?
As long as it's within that 3 minutes, if you don't mind just having that individual state their first and last name.
Yeah, absolutely. I run Hooch, the craft cocktail bar, and I would like to hand my time over to Jimmy Yeager. I felt like he was bringing up a good point on a couple of matters, and he really does speak for a lot of the restaurants here in town.
Lindsay, is Jimmy next to you? Jordana, maybe you want to, let's see.
This is Suzuha. I apologize. Unfortunately, yeah, it's 3 minutes per person. And so we're able, sorry, Lindsay, I think we were under the impression you're going to give it to someone who hasn't spoken yet. But we'll need to restrict it to 3 minutes per person to speak.
With that said, Lindsay, do you have anything to say, or if not, I can move on to the next individual.
No, I completely understand. I'm just an individual who works in the community. Both my husband and I work in restaurants and sort of depend on this livelihood. And as you can hear, my 4-month-old daughter depends on our livelihood as well. So please, you know, we're people and we're individuals who really, really do depend on this work. So please kind of take that into consideration before you make us jobless.
And you keep the mountains open and Ski-Co gets to run things.
Thank you so much.
Thanks, Lindsay. Next, we have Shane Underwood.
Unmute. Hi there, can you hear me? Wonderful. I'm also a renter in Snowmass. We live in Michigan, so we know what it's like to be locked down. Unfortunately, that hasn't worked real well. And as a family of 6, I have found that when my kids had smallpox, I threw them all in the bathtub. If you all remember that, you wanted kids to get it over with right away. And I feel like the whole lockdown of putting everybody inside, which we have experienced here in Michigan, has just only increased and elongated the COVID here in Michigan. The other thing I have a question regarding, and that is we want to come to Aspen too, but I'm sitting here going, is the mountain going to be open? What are we going to be able to do? And so my question is, when will we know that? My husband and I also have both been vaccinated. We've been very fortunate to get the vaccine, so we're done. We're good. But does that mean we also have to get the COVID test? And I wasn't sure what the requirements were. I also checked the Picken website for that. So any explanation of that would be greatly appreciated. Appreciate you all. This can't be much fun, what you're doing, but y'all look pretty happy. I see smiles once in a while. There you go. You know, this is a short-term thing. You know, I mean, it's horrible, but we're going to get through it. And the only way we get through it is get through it together. So thank you for the time, people. We appreciate you.
Shane will be answering your question when we go back into session as a board. Okay.
Thank you so much.
Next, we have Samantha.
Hi there, everybody. So a couple of comments that relate to the couple that spoke about the rapid testing. I feel that Picken County and the Board of Health could do a better job of helping us control the virus and keep our economy running and restaurants open in regards with testing. I heard John Peacock talk about how we have the second highest rate or the number one highest rate of testing in the whole state for a county without a prison. And all that testing is great, but if we can't get results, what good is it? I know as a restaurateur, I have had to wait 5 to 7 days sometimes to get my employee results back from the free testing. It's gotten to the point where we have either split the cost of the rapid testing or just outright paid for rapid testing or the 24-hour PCR testing with the 2 private locations, one next to L'Osteria and one next to the Wild Fig. And we're willing to even take on that cost if it enables us to turn our results around quicker, get people out of work, get them back to work, and get operational. I think that the city and the county helping us with testing could really make a huge difference. And I also want to say, I don't know if you've all read the paper, but there are several articles from people in support of keeping our businesses open. And I fully support what Jimmy Yeager had to say. And I think it would be great if he could have more than 3 minutes because he represents 1,500 people in this town that don't have the quite the gift of speech as he does. So I think he should be allotted a little more time. Thank you.
Thank you, Samantha. We will move on to Chris Bryan.
Hello, this is Chris Bryan. I'm a lawyer in Aspen, and I represent 4 different restaurants that have asked me to speak today. This morning, I received from the Pickens County Attorney's Office a spreadsheet that itemizes the outbreaks since March, and it has the number of current cases and the current outbreaks, and it lists restaurants as 89, which it says are 51% of the cases. And in reviewing this document and talking to the Pickens County Attorney's Office about it, it seems to me that some of these attributions are simply not correct, and I'm worried that this board is going to make a decision to close down indoor dining based on this misattribution in the data. For example, with outbreaks, which is defined as more than one over a 14-day period, you've got some of these for a restaurant, it says 2, and I actually know what restaurant that refers to that happened in November, and it turns out that neither of those people from that restaurant were actually on site. One called in and said, I think I've been exposed, I'm not going to come in. The restaurant reported that to the county. And then another employee said, I think I've been exposed, I'm getting tested, I've turned out to be positive. And neither one of those people actually came on site. So my concern is that you're attributing the vector at a restaurant under the assumption that people are contracting and transmitting the virus at that restaurant, when in fact, the restaurants are actually one of the safer places to go right now because they are doing temperature checks, they are doing reservations, they are taking information that they can share with contact tracers. The Pickens County Attorney's Office also shared with me that the contact tracers aren't able to keep up. So they don't know if these transmissions are happening in restaurants or if it's merely people who happen to work at restaurants that contracted elsewhere and then are going through the mandatory reporting process. So if you shut down restaurants, you're actually losing a major source of information about how to handle this problem. And I find it highly unlikely that, as this spreadsheet that the Pickens County Attorney sent me says that there's 0 cases from grocery stores, how could that really be? But there's 89 from restaurants? My fear is that this data that's been presented to us, and presumably to you as well, is giving you a distorted view of how these transmissions are happening, and you're using too blunt of a weapon here when you should be using with surgical precision a scalpel. And that's what I want to avoid. I don't think shutting down restaurants is in your best interest here. I do think that there are scofflaws that have 18 or 15 cases of transmission, then you need to enforce against those, not close down the industry completely. So I would recommend that you stay the course and enforce better against restaurants that don't comply, not shut down the whole industry.
Thank you, Chris. We'll move on to Eric Smith.
Hi, I just wanted to give my 2 cents. I own a large restaurant business in Baltimore, Houston, and Florida. Just to give you an idea of the scale of our business, last year we did 85 million in sales. During my time, we haven't had to close our places in Houston or Florida since the initial outbreak. In Baltimore, we recently just got shut down by our mayor. But I just wanted to touch on some data that maybe you guys aren't necessarily thinking of. It's coming from somebody who's experienced this. When you talk about PPP, how there's going to be a second stimulus, that is correct. There will be 2 pools. However, that PPP money is only usable if you can open up again after your operation shutters. Now, including that, you can only use it for rent, which is for 25% of what you receive, and the other 75% can be used for employee wages. But again, I want you to keep in mind that you have to be able to reopen to get that. And the amount of product that we carry in our business, if you were to shut us down overnight, these people are not going to be able to survive it. Trust me. I almost shuttered a couple of my places. Luckily, I had some rainy day funds stored up. So just keep that in mind, that the amount of product they have, they're not going to be able to go through. And the amount of product it's going to take to reopen is a tremendous amount of money. The second thing I want you to keep in mind is there's a lot of foreign workers in our business. And those foreign workers will not be able to receive unemployment benefits, okay? So you've got all these people that have kids, that have families, that live in your town, that will not be able to go on unemployment. And I'm feeding, literally out of my pocket, over 450 families a week in front of my restaurant. I give them bread, I give them chicken, I give them produce, I give them anything they can use to survive, toilet paper. But just keep that in mind. You're going to put a lot of people out of work, people that aren't necessarily going to be able to receive unemployment and aren't going to be able to survive and take care of their families. Also, I might recommend, if you guys are going to do this and go through with it, I would go to 25% for a week and give them a notice of shutdown, and at least let them burn through their product. That'll help a lot of the restaurants out, and they won't have as much waste. Thank you.
Thank you, Eric. We'll head over to Wendy Mitchell.
Okay, I know you guys have a little Wendy fatigue going on, so I'll try and keep it something new and fresh. I think everyone knows my position. I don't think we should close indoor dining unless people want to do that voluntarily. I don't think that's where the problem's coming from. I do think we need better science to find out where our infections are coming from. But I think if the decision is to close down today, I would really appreciate that you guys do it thoughtfully and think about all the businesses that need to be monitored in order to get the rate down. I don't think closing restaurants is going to get the rate down, and we need to reopen. So if we can keep this the shortest amount of time and the smallest impact to our community, and just make it fair for all businesses. Hotels, under my understanding, are still at 100%. We're encouraging people to come here. And you have to understand, if you live in a city like where I'm from, Houston, and you can come to Aspen and be outside and ski, and maybe you have to eat takeout in your hotel, it's still better than being in Houston, okay? Sorry, fellow Houstonians. But SkiCo, 100% capacity. I saw some mention of a reservation system, but we can't have SkiCo at 100% capacity. It is encouraging people to travel, which someone else on this call said, CDC has recommended non-essential travel be eliminated. Why are we encouraging people to travel? If you want to stop the rate, you have to take all of these aspects into effect, not just punish restaurants. And then, finally, like this weekend, we have this thing going on, and I'm like, all my friends are skiing with their friends every weekend. Is that allowed? Are we single family skiers, or are we allowed to ski with friends? Can we go skin at Buttermilk? Is that allowed? I mean, I don't think people know. So think about what you want done to stop this, not just punishing restaurants. And then I'd also like to say, for restaurants, I think that, these testing programs, like
Susanna and Isaac from Aspen COVID testing are doing a great job at letting us get our employees tested. We're paying for that. The testing could be part of the 5-star program. And I know that the county has a lot of tests available. So maybe they'd be willing to allocate some of those tests to a testing program for restaurants. And then finally, contact tracing is another big thing that people are talking about. We have a contact tracing template now that we fill out as a restaurant. We are pretty good at what we do, and we can contact trace our businesses. We're trying to stay in business. We don't want sick people at work. We want them to stay home. There's government money for people to stay home, and we're paying them that. So let us do the contact tracing and take some of the pressure off the people that are complaining about contact tracing.
Thank you, Wendy. We'll move on to Allison Gish.
Unmute. All right, can you hear me?
Yes.
Okay, just a couple things really quickly. One, I don't agree that we should shut down. I agree with the restaurant people on the call that I don't think that's the bulk of the problem. And I do think it's really about what our public health system can handle. But I do have one other quick thing regarding the gentleman who called about multiple families staying in one condo. We are going to be facing that same situation here at Dancing Bear as different people try to come in from, adult children with the parents and that sort of thing. And if they have all tested negative, I'm not sure why we're restricting that. Or I do like the idea of making them take a rapid test closer to the time of arrival. I think that should be considered as you discuss this further. That's all.
Thank you, Allison. We'll move on to Christella.
Hi, thank you. This is Christella. I work for the county and I'm also a resident of Pitkin County. I am a contact tracer for Pitkin County. I'm speaking to you today because I do hear a lot of things regarding contact tracing. One of the things that I have heard is that we're going back and forth with this restaurant. I understand that people need to work, have to work. One of the things that I have spoken to, I just came back from maternity leave, and this whole week has been speaking to people who work at restaurants who want, just today, I spoke to somebody who was very, very, very ill. He could barely speak to me through our interview. He was coughing nonstop and gave me permission not to use his name. I told him I would not use this individual's name, but he did say that it was okay for me to mention just how bad he is. He says, I don't wish this on anybody. Yes, we all need to work, but we need to get a handle of this because what he does for a living for Pitkin County, people are canceling their reservations for next month because they're afraid to come here, is what he has told me. They're afraid to come here because we don't have a handle on the case numbers rising. And, for me, I have family members here in Pitkin County, Eagle County, who have tested positive recently, and as far as 8 months back, who are dealing with long-term effects that they still don't have sense of smell back, don't have sense of taste back after 8 months. I'm also speaking to you as a person who has lost 2 family members to COVID. It's not something that I like to play with, and I'm so frustrated hearing people. I understand that people need to make a living, but it's so hard to speak to these families that they want to make a living, but they're also so sick that they can't. Like, why didn't you say anything? Why I speak to them, I ask them, why didn't you mention anything before? Did you go to work when you were contagious? Yes, I did go to work. Did you know that you're supposed to stay home? Well, I just thought I was sick and I just can't take days off of work. So I don't know what else to say other than I hear all of these community members and I feel for them, but I'm coming from a person that has worked in healthcare for all of my career. And I know that it's important that these things are discussed. I want them to stay home, but I also want them I want to make sure that they're able to make a living, of course. But as a person who's a CNA and MA, I just want you guys to know how bad it is when people are overwhelmed at work, at the hospitals, at clinics, that they can't do their job right. For us, it's been so extremely stressful trying to keep up with these cases and these contacts because there's been so many. And, you know, it's my job and I love doing it. I want to help people, but I also, I appreciate the help. It's just my 2 cents. Thank you for listening.
Thank you, Christella, for speaking. I will like to mention to the board members that Marky did request that public comment continues till 3 p.m. So I will continue selecting a few individuals until then. Greg?
Hey, everybody, you can hear me. This is Greg Balco, one of the ER physicians here in the community, and I'm speaking on my behalf and nobody else's. First of all, I want to say thank you. You don't have an envious job, and I certainly wouldn't want to be sitting in your position. I'm on the front line here, as last speaker was also, and I see firsthand what's going on. And all I can say is that as the incidence is going up, the number of cases that we're seeing in the emergency department is going up, and it's very palpable. And we're seeing sicker and sicker people as we go along here. And I've seen countless number of people coming into town who are unaware of the affidavit and the testing requirements. I've seen countless number of cases of people coming to town with their families from all over the country, and they spread it to one another. I see countless number of cases of people who get it just because they're frankly irresponsible. And I have lots of frustrations over this. As you can probably tell, I certainly am a bit frustrated there hasn't been any kind of enforcement, as I think that probably could have helped our cause a little bit, but I think that we've got to do something, and that's up for you guys to decide what to do. But we can't keep doing what we're doing because the numbers are going up. We're getting more and more sick people in the emergency department, and we just got to do something. So with that, I'll yield my time.
Thank you, Greg. We'll move on to Sam Hayes.
Hi, good afternoon. My name is Sam Hayes, and I'm a concerned citizen and an employee at a local restaurant. I'd like to add on to the LA comment that old PC talked about. Los Angeles actually went into full closure on November 25th, and we still see those cases continue to rise. So I don't think that we can really compare us to that. I'd also like to note that we put out a petition over the weekend, and over 3,200 people have signed that petition in order to keep restaurants open. And I think that's very important because those people are a part of this community. Those people are the ones that go to work every single day, like myself. We absolutely love this community. And that is closer to what I believe the 1,500 employees instead of the 1,200 that was stated before. I also think that financial assistance should have been set up way before the meeting that we're talking about today. I've also noticed that you're relying on a lot of mainly state and federal level for assistance. A $600 stimulus from our federal government does not do anything. That's a quarter of rent for most people that stand to lose their jobs. Where will they eat? What will they do? Also, I'd like to ask, where's the support for the mental health that this is going to cause? Financial instability ultimately brings that on. We already know that Pitkin County has a high level of mental instability, and this is only going to add on to that. I'd like to add on to what Mayor Torr said, and I was recently taught the saying, don't ever throw the baby out with the dirty bathwater. Why are we punishing restaurants and businesses that have been doing the right thing this whole time? We need to reward those businesses and restaurants that are doing it with maybe starting them on the 5-star program right now. My last is for Jordana. If you go back and look at the county examples of that have been in red and are now out and are on that 5-star program, I honestly don't see a comparison to us. One of those was Arapahoe County, Southeast Denver. Where's the population fluctuation over the holiday period where we are seeing a lot of these cases from the last few weeks? That's it. Thank you so much.
Thank you, Sam. We'll move over to Beth Mobilian.
Hi, I'm just curious. These are amazing comments and amazing questions. Are we going to hear back from you all? How will we know if you've taken them into consideration? Is it possible that you're going to take them into consideration, or is the deal already done? I'm just wondering where this all goes. So maybe I'll yield my extra minutes to Marky to answer me.
Yeah, Beth, I was just hopping on. Basically, what we've done is noted all the comments and made notes accordingly. We are going to be addressing responses to the questions and comments as soon as we close the public comment. And that would include Kim answering Jimmy Yeager's question. We had questions in terms of the persons that were bringing 3 families here in terms of dealing with the Facasas and the Verbals of the world and all of that. We're going to get right back into that, Beth.
So this is not an absolute done deal. These are questions and comments that you are going to take into consideration.
Right. Absolutely.
Thank you so much. I appreciate it. Thank you.
Mm-hmm.
Okay, we will move on to Jackie M. Jackie M., are you able to hop on and talk? I do see you have your raised hand feature open. Okay. Maybe some technical issues. I'll move over to Benji.
Yeah, so my question is, I actually work at Clark's Market Deli in Aspen, and if everything closes down and all the restaurants are closed, we only have 2 grocery stores. What happens to us essential workers being put on the front line? Do we get anything back? What happens to us? Because we're just put in front of the face of everyone. Go ahead, rebuttal to me.
Benji, I'll answer that very quickly. The grocery stores are considered essential businesses, so they will stay open.
Absolutely, but what about the workers that are working there that are being put in front of the front lines of everyone if the restaurants are shut down?
I'm not sure I understand your question.
If the restaurants are shut down, all the tourists have no place to get their food except the grocery stores, and we get swarmed with all of our tourists. What am I supposed to do as a worker that gets the full front of it?
Benji, is it BJ or what is it, Benji?
Yes.
Okay. What happens is there would be takeout, delivery, options for.
Well, I understand that, but as a worker on the front line, I am being exposed to the infection more than anybody else in the valley.
That is probably an impact. That is an impact. I can't.
So what, as frontline workers, do we get as being the frontline workers when everything else is closed? Because yes, we are an essential business and we will not be closed down. What do we should get some sort of supplement for that, correct?
I'm not your employer. I don't, nor can I answer that question.
Well, then let me ask you this. How do you feel about your grocery store workers that are put in the front line in this situation?
Well, to tell you the truth, I appreciate all my grocery store workers. And we're going to move on because this is a side conversation that we would need to have with the owners of Clark's and City Market.
Okay, Marky, it looks like we might have time for one more. I will select Jaden.
Hello. Hi, this is Jaden. Thank you for taking my comment. Give me 1 second to get in a quieter place. I am a worker here in Aspen. I rely on the businesses here as my income, my main source of income. So I am just here to voice my support for restaurants remaining open. Basically, I wanted to address a little bit of what we're talking about, the CDC guidelines and restrictions in general. At some point, may I remind you that in early 2020, while the nation's top expert, Dr. Fauci, for this disease, said that people in China wearing masks was not something that here in America we had to do. And of course, that has changed drastically for whatever reason. I'm not saying that we should not wear masks. I'm just saying that the information that we have and that we base our restrictions and all our protocols for this, pandemic may not necessarily be 100% accurate. And I think we're all aware of that. But, it's what we know best to do. And so we do it. But regardless of that, I think that it is safe to say that it is not 100% effective and not 100% necessary because, as we have noticed, high number of cases does not necessarily mean disastrous conditions for us or even unhealthy conditions. Someone that is asymptomatic basically represents someone that is immune to the COVID-19 disease, not immune to the virus, SARS-CoV-2, but the disease that causes, many health effects on very specific groups, such as individuals with asthma and pre-existing health conditions. And such, not necessarily just those, but we do know that there's a high concentration in those age ranges that include the elderly and people with pre-existing conditions. May we focus on those? May we perhaps take some notes on what Will Cook and the Vail Health team have been doing. They've done an extraordinary job at taking care of the effects of this virus, and as Eagle County has done with not so many oppressive restrictions. I do appreciate all the work that all the healthcare people are doing. I do not discount your work and your efforts. I'm just stating that perhaps the strict and oppressiveness of it may be less. And lastly, I just want to remind you that skiing is one of the ways that us as locals maintain a mental health. It is one of the ways that during winter months where we can just either stay home, we can go out and exercise and have that activity for just peace of mind, health, and in general benefits. I ask that you also keep the mountains open. So I appreciate that. I don't know if I'm running out of the time, but I do just summarize by stating that I support restaurants and businesses remaining open, including Skiko, and as well that we take into considerations the data that we here as a community have gathered, showing that a lot of cases does not necessarily mean a lot of sickness. So I appreciate that. Thank you.
Okay, it's 3:01. I do see, okay, looking at the number of hands still up. I'm sorry, we really do need to move on into the next part of our agenda, which would be staff clarifications. Jordana, would you like to answer many of these questions? And I hope Kim Levin is still here so she can answer Jimmy's question.
Thanks, Marky. We've got actually a slide that Josh put together to respond to Jimmy's question. And so I think I will start with Josh, and we've been keeping track of the questions and have assigned them out to staff members. So when Josh is finished, he can pass it along to our next team member to address everything that we heard.
Great, thanks, Jordana. Next slide. So I wanted to discuss the model that was shared during in an epidemiology situation report that the Board of Health had reviewed. So this projection was created here locally in Pickens County, and it was created back in November. We have not adjusted the model since November, and that was purposeful. The reason was to look at where we were in November and understand and look at the trend to see where we might end up in January. This model did not, it factored in a lot of different conditions. However, a lot of those conditions have drastically changed. That's what we see in a pandemic, is that things are constantly changing, and it makes it extremely challenging to model or predict what we expect to see moving forward throughout the pandemic. And so I want to just highlight a few things that have changed since this model was first shared at the November 19th Board of Health meeting. First, we've noted many cases of reinfection among Pickens County residents, individuals that tested positive once and then several months later redeveloped symptoms and tested positive again. Those individuals have been recounted because they have a reinfection according to CDC and CDPHE guidance, and those were not factored into this equation. Secondly, the vaccine rollout did not meet the expectations that we thought it would, and that's a nationwide, not just specifically here in Pickens County. And so looking at where we expected people to be in January in terms of potential immunity, we did not see that come to fruition. Mobility has also increased more than we thought it would among Pickens County residents, so that has also changed the model. We've had protected populations that have been infected that we thought would have been infected at much lower levels, i.e. Individuals that stay home and really only go out for very short excursions and essential goods that have been infected. We have seen an increase in those individuals. Our reproductive number has increased, so the number of people that are exposed and infected for every one case, that has gone up substantially, and not based on, or not what the model had predicted. And then lastly, holiday impact was not calculated into this model. You can see the lines are straight. They just go straight out. There's no fluctuation based on holidays. It was really to show this is where we're at, and this is where we expect in general to head in the next few months. So when looking at this model, really the purpose of this model was to understand general trends in viral transmission if we did not enact strict mitigation efforts. And the idea was to really see where are our case counts going to go relative to where we have been. And then secondly, to recognize the potential severity of spread given a large range of variability. You can see the green and the red lines are extremely far apart from one another, showing the variability in these models and how they are very imperfect. CDC also makes a note on models that models make various assumptions about the levels of social distancing and other interventions, which may not reflect recent changes in behavior. So again, this model was over 2 months old and should not be used to predict where we are headed in the future. Secondly, even if we do begin to see a plateauing at some point of cases or a reduction, we are at an extremely high level of infection in Pickens County. 3,000 cases per 100,000 people is an extremely high incidence rate over a 14-day period, especially for a county as small as Pickens County. And so I just want to reiterate that this is not, the comment that was made in the situation report was not indicating that there will be herd immunity anytime soon. It was indicating that we might see an inflection point, meaning we might see that dip in cases slightly. Doesn't mean we're going to head back down to zero. It just means that we may expect to see a slight dip here. But again, that did not take in all these other factors into consideration. So I just want to be very clear on that these models should not be used to make any sort of policy decisions, and they should not be used to forecast what we expect to see going forward, because statistical modeling is extremely challenging. And I just wanted to make that extremely clear to the board that, I put this together, and I would not say that we should use this for any sort of decision making moving forward. So Jordana, I can answer a few other questions if you want me to, or I can hand it back to you at this moment.
Yeah, Josh, I think if you can run through the ones that you've kind of taken on as assigned, we will try to get everyone's questions answered as efficiently as possible.
Sure, will do. So a question came up about why there was a small percentage of cases in New York versus what we're seeing maybe elsewhere, pinned back to restaurants. And so the reason why, and I think Dr. Siebold may have alluded to this, but another reason why so few cases are affiliated or associated back to restaurants or any other public setting for that matter is because it is extremely difficult from a contact tracing perspective to be able to pin someone's exposure back to a public setting. We cannot with any sort of certainty say this person ate in a restaurant, there was another case in that restaurant, therefore they were infected in the restaurant. We do not make those kinds of assumptions. What we do try to determine is, was there a likely reason or rationale for exposure and transmission? So if we know that two individuals are working closely together and they admitted to working closely together during that individual's infectious period, then we can easily say there was likely transmission between those two. We can never confirm transmission between any two individuals. We can only say that is the likely scenario that occurred. So that is the reason why you're not going to see a lot of cases pinned back to restaurants or any other public setting. Secondly, an individual had mentioned that we received a report from our attorney regarding recent case counts. So those case counts that were shared were outbreak associated cases in the past 14 days. And so we only consider an outbreak when there is 2 cases that have occurred within a 14-day period, and it is clear that there was likely transmission there and not anywhere else. We do ask an array of questions during contact tracing to determine where spread may have occurred. And we do discuss each case and each outbreak to determine, does this individual, were they associated with this outbreak, or could they have been exposed in the household or elsewhere? So we do take the time every single morning to go over these outbreaks and ensure that we are documenting them accurately and correctly. So I want to make that point clear. And then secondly, a comment was made during that from that commentator that there were 0 cases in grocery stores. There was not 0 cases in grocery stores. There were 0 outbreak associated cases found to have transmission occurring within a grocery store within the past 2 weeks. So by no means is the data indicating that there was not a case associated with the grocery store. I don't actually have that information in front of me, but this was outbreak associated cases, meaning there was transmission that occurred from one employee or one individual to another within the grocery store setting. So I wanted to make that point clear. Near the end, there was a comment on mask wearing and why it was discouraged back in March and April. Mask wearing was discouraged back in March from Dr. Fauci because healthcare workers had the highest risk of exposure given the low prevalence across the nation to the virus, and we had very limited PPE for the general public. So they're really trying to determine who is most at risk, who needs the masks right now. Once prevalence increases and we see more cases across the country, then of course we want everyone to begin to wear a mask once we have the supplies available. But that is why mask wearing was discouraged back in March. And then my last point is 40% of, I think there's a comment as well about long-term effects, 40% of the individuals that we have interviewed 6 months after their original diagnosis date have demonstrated long-term effects. And they did not, I'm sorry, 40% of those that we've interviewed that had long-term effects did not report any underlying conditions. 60% did have underlying conditions, 40% had 0 underlying conditions, yet are still suffering from long-term effects. And just to give you an idea of what these long-term effects are from some of the individuals that we've interviewed here in Pickens County, the phantom smell or loss or deficient smell, exhaustion and fatigue, inability to work, lung and heart damage, individuals reporting still being on oxygen several months out, blood clots in the lungs, losing 20 to 30 pounds in the month or 2 following infection, and have not been able to maintain or regain that weight, nerve conditions, constant brain fog, decrease in lung function, and so on. About 10% of the individuals we talked to have not been able 5 to 10% of the individuals we talked to had not been able to return to work at the time we had talked with them. So these long-term effects, again, they are very real. They do not only impact those who have underlying conditions, they have been found to impact individuals that were considered healthy prior to their diagnosis. So I think, Jordan, I think that those were my answers or responses to some of the comments I had heard.
Thanks so much, Josh. Kurt, can we turn to you for the testing questions, and then
Yeah, Jordana. Couple of pieces that we heard with testing. We wanted to highlight the idea about rapid testing and increasing testing. And again, with the second highest incidence rate in the state, we also have the second highest per capita of testing. So, I don't know that testing volume is an issue. Testing is a mitigation strategy, but it's also not the only one. And it's in order to be successful, you need to have more than just testing occurring. So we're not going to test our way out of this piece. If you remember box it in strategy that we've talked about for a while now. There are 4 corners of that piece, of that box. Testing is one corner. There are 3 other corners there that we have to address as well in order for that to be effective. And again, given our incidence rate right now, box it in isn't as effective as it could be because we have so many cases. So again, it's just one of the mitigation strategies that we have, but it cannot be the only one. We have to couple that with others in order to be effective with reduction. The question about testing here and having multiple people stay in a condo, the important thing to remember when you test as a traveler affidavit is that is prior to coming here. So then you still have risk of exposure here. And so then if you're still continuing to share that condo with your other households, you still have an increased risk of disease transmission. So that's part of the reason why we're still saying you should not be sharing that. Households should still not be sharing a condo or a hotel room. There was a question from an anesthesiologist about the testing requirement for the traveler affidavit if they have been vaccinated. Unfortunately, right now, the CDC has not provided guidance on how to handle that. And what we have received from CDPHE is until we receive that guidance, that we continue to move forward with the testing protocols that we've set up. And the CDC actually, they have a statement that says at this time, those who will be fully vaccinated by the time of their travel should anticipate needing a negative test where those places are required a test. So we understand your frustration, but I think there's continued research on the efficacy of the vaccines and how that gets employed with testing. So we will update our guidance as soon as we have that additional information, but at this point we do not. And the other piece that they're talked about, trying to set up a mass testing program with some of the tests. We do receive rapid tests from the state health department. We've been utilizing those, one for a serial testing program with our first responders. And then we've also been using them to try to help with control of outbreaks. And the amount that we're receiving from the state is based on our population. So we're utilizing all of these tests just in these scenarios with what we already have. If we could attain more, there would still have to be set protocols and a process in place for us to be able to do something like that. But the limitation right now is the amount of tests we have. We're not able to set up a larger testing protocol through our own systems. So I think those were the couple of things that we heard with testing, Jordana.
Thanks, Kurt. And Brian, over to you for the last on the 5-star and enforcement questions.
Yeah, so the 5-star program, we are pretty far along as far as getting this application ready, and we just need to get buy-in from our community, from the different cities.
Members of the administrative committee will write us letters of support.
And once we have that, we can have this application put in pretty quickly, and we have the staff and ability to get this off the ground pretty quickly. Obviously, we still do need to see these incidence rates to have a sustained decline for 14 days, because that is a requirement of the state's system for this variance for the 5-star program. Hopefully that will happen pretty close to 14 days from enacting this new stricter measures. And once we have that in place, this company or the businesses that are willing to participate in this, for restaurants especially, will be able to open back up to indoor dining as long as they follow these enhanced criteria that are mentioned in the 5-star program. And under the red level, that includes tables being 10 feet apart, the requirement of a reservation system, and there was a third thing that I can't think off the top of my head. But yeah, I think that will hopefully give the ability to open these back up more quickly than waiting for us to get all the way back to these orange levels. And then for enforcement of these private parties, as we hear about them, we are doing what we can to either prevent them from happening or coming back to make sure that they are aware that those are not allowed and issuing notice of violations if appropriate. We have reached out to catering companies and valet companies and the like. As far as we know, people are aware of these restrictions. There are many, many private caterers, private chefs that don't hold business licenses or anything like that. So it's hard to get a good handle on every single one of these people. But as we hear about them, we're certainly looking into that. We are investigating every complaint as soon as we can, and generally are less than 24 hours before we're addressing those.
And Brian, I'll share that at the bottom of the website, the Pickett County COVID website, you can click report a public health violation. You can either make a complaint there, and then also if there's a violation, a blatant violation that's going on in the moment, we encourage anyone to call the non-emergency dispatch number 970-920-5310. And our law enforcement partners will respond accordingly.
Thanks, Jordana. That's a great point.
I think there were just a couple other continued clarifications, just the clarifications that restaurants aren't closed, indoor seating is closed. As Marky stated, there will still be takeout and outdoor dining with just the household that's available. And for the grocery store worker who called, I think that we are recognizing the continued work that you do to show up every day on the front lines. We are grateful and appreciative, and also think that it's our job to work through to get this incidence rate down so that you are not as much risk going to work. And then also that the vaccine distributions to essential workers are next after we get through those that are 70 and older. Essential frontline workers are the next in line for vaccinations. And then another just general clarification, someone asked, well, should I be skiing with my friends on the weekends? Should I be gathering with other folks? And that we can do a better job of continuing to put out the message that informal gatherings are still limited to your household. And with that, Marky, those are all the questions we have noted to clarify from staff's perspective.
Okay, I got several other questions coming in, just ones that I could not answer based on our conversations thus far. In terms of experience in these other counties, about how long did it take them when they closed indoor dining? How long did it take them to start bending their curve? 14 days or before?
Josh, I don't know if you have an answer to that. Marky, I can look, but I know that many of them were bending the curve earlier, and then they stayed in it for 5 or 6 weeks before the governor moved everyone in the red to the orange.
So the whole thing of the 350, which we know is off the table, the 700, if where we are now, we're about 2,500 or 3,000 incident rate in that neighborhood. So if we would begin to see a decline and we were down to from 3,000 to 2,000, would that still give us the opportunity to do the Red Star program because we're seeing a decline? Okay. I think that helps with some clarification. Okay, then there was another question that came through, and I think the board may have received this. As we know, we have business that's all outdoors, and that's T-Lazy 7 snowmobiles. And what's the situation and what's your thought there and recommendations of staff?
So under the red level restrictions, Larissa, I don't know if you have those off the top of your head, but that would be an outdoor tour company, and they are still permitted to occur, but at a reduced level. And if you give me a minute, I can look up what that reduced level is.
And I do think Dick acknowledged that in his email to all of us.
It's 25%, Jordana.
Thank you, Larissa.
Yeah, 25% capacity.
Then there was another request that did not come up today, and that was Redstone. Redstone has not had any outbreaks that we're aware of, like 0% COVID cases, and I would argue that Meredith is probably the same. What's the thoughts of staff accordingly?
That's correct, Marky. We have not attributed any outbreaks to Meredith or Redstone.
So would we recommend keeping them in since they're part of Pickens County if we were to move forward with recommendations of staff, or exclude them?
At this point, we haven't made any recommendations to exclude any areas in Pickens County. This would be a recommendation that applies across the county, but if that's a discussion that the board wants to have, I think that could be made at that level.
Okay. Okay, any other questions or issues or from your constituents that you've heard, Greg?
Just wanted to clarify. I know Wendy asked, can she go skiing? I don't know if it was a rhetorical question or not, but I'm under the impression that you can gather with a friend and go skiing as long as you maintain the social distancing and the masking the way the ski company implies. So I want to make sure we're clear on that. The informal gatherings outside on skis, either skinning up or down, are those rules changing?
Greg, we haven't put in, Level Red doesn't add any additional restrictions, just that those informal gatherings are limited to your household only.
Great, thank you. So that was just to make sure that Wendy's question, it kind of rang out, but I didn't hear the clearest answer. Thank you.
Other questions from members of the board relative to public comments or other thoughts that you've heard or comments from from those you've been in contact with, who obviously, yeah, Greg.
Yeah, sorry, thanks again, Marky. Just regarding the serial testing, I heard Kurt's response, and it sounded as if the county might have some limitations regarding serial testing on a more an increased basis. But are we pursuing the possibility of working with outside companies to expand that if it is meritorious?
And I might take that on if that's okay, Kurt. So I think the short answer is yes, we're continuing to work with the state to see if they can support more testing. We have been talking to Aspen Labs as a potential partner in that. And so we're still hoping to put those types of opportunities together. As Kurt had indicated, that could result, frankly, in a short term, a higher incidence rate. But I think, as previous speakers have said, the hope is to get that isolated then and tamped down.
Brent?
Yeah, just as to that testing issue, is there any reason why, if a company, and I believe a few have, say, look, we'll come up to Aspen and start testing tomorrow or the next day? Do we need to seek permission to allow testing? I mean, I'm not sure I understand the holdup. In fact, I never did understand why private enterprise, because a couple of them have even called me and say, you know, turn me loose. And so, and to me, again, the more testing, the better, even though it bounces our rates up short term, it gives us a much better idea of where we are in this infection cycle. I mean, that's one question. Number two, again, comments about picking up from the public. I think use of the RET should really be pushed. I think that's a terrific idea for some sort of additional support. And then lastly, this is obviously such an important decision or set of decisions. And the fact that Jimmy Yeager represents, and I think the comment was 3,000, maybe I have that wrong, but that's a huge, significant, you know, part of the business population. And I just want to make sure that we give due respect to that. I mean, that's you know, a supernumerator or whatever the word would be. And I just want to make sure that everybody feels that they're being treated properly. Thanks.
Bill Matson?
Yeah, just the RET has been brought up a couple of times, and I just wanted to make a clarification that the proceeds are restricted by law, and so we couldn't use them for an employee support program, but there are general funds or other ways that we could address it.
Okay, I mean, and I'm not sure what we said by law is that we're not, are we talking about state law?
Yeah, they're restricted funds, so we would look for alternatives.
Angles or borrow or I don't know what, but yeah.
Yeah, Brent, they're voter approved. And
Right.
so to change the use, it would have to go back to the voters.
Well, there might be some way to do rather, especially today with incredibly low interest rates, there might be a very reasonable way to borrow money. And then, you know, we'll worry about that some years in the future.
And that
We
has
would, yeah, and just to be clear, one, this is probably, it's a fine discussion for the Board of Health to encourage the municipalities and counties to look at these resource allocations. In order for a public entity to take on debt in Colorado, it needs to be voted on at a general election. So, you know, that's not till November. And RETs do have constitutional as well as ballot language restrictions around them that make their use a little more complicated.
Fair enough.
Yeah.
Okay, I just received another comment from, I'm not going to say where it's coming from, but it's from a private, well, came through the Snowmass Club. I might as well say it because you're all going to guess. Why are we not considering just a total shutdown of all non-essential businesses? And I think Jordana and her team discussed that much earlier. I haven't responded back, but Rick, I appreciate your 2 cents worth, as you call it. And I'll get back to you after we finish all of the discussion in the meeting. Kim, did you have a comment?
Yeah, thanks, Marky. You know, I just wanted to reiterate what Josh had outlined about the modeling and the importance of data and really understanding data. The modeling and a lot of the points that Jimmy had made were really based on what modeling is, which is your best guess into the future. And we really don't know what the future holds in this. This pandemic has proved that over and over. So we know what the data are right now, and we need to work with what our numbers are right now and not, modeling does have a place, but unfortunately, some of it doesn't always work and pan out in the way that it was modeled. The other thing I want to emphasize is the vaccine, and it is in the early phases right now, and it's kind of the tip of the iceberg. So we can't rely on it as being the source of changing the course at this point. We will hopefully rely on it once we have more masses vaccinated, but that is coming in months. And so we really need to look at some of these other mitigation efforts at this point in the meanwhile. And that was it.
Thank you, Kim. Anyone else, Greg?
Yeah, Marky, thank you. I did want to point out, as Brent said, we've heard from a well-organized and very vocal part of our population, the community, who are certainly frontline people whose livelihoods depend upon on tourism and on tourism dollars, and are spending our money in the restaurants. And I have to say that, it's hard to listen to it because these are all friends of mine, and it's very painful. We're also hearing on the sides, I'm getting letters and phone calls and texts of concern from families with kids who are thinking that their families have been shut down because they cannot get back into the schools. We've heard from longtime residents who are demanding that we shut things down. That the words that I like the voice from the Snowmass Club was not an uncommon concern. I'm hearing this as well from people who are saying, why haven't you done this yet? We gave it a try in November. We should have shut down then, and we didn't because we wanted to help the business and the restaurants stay open, but that hasn't worked. So I just wanted to say that the entire community has varied opinions, differing opinions, depending on how they're going to get through this. And I know we're doing our best to come up with ways to get everyone through it intact, but I'm struck and I'm impressed by the vocal and organization that Jimmy and Samantha put together, and Wendy. But I want them to realize we have a very large population of people who are afraid to leave their house and are afraid to go to a restaurant. Quite frankly, I know people who have sworn they're not going to set foot because they're fearful for reasons which may or may not be valid. But that's what we stand with, and that's what we have to look for. If I could, I wanted to share another comment I received. This is from a local food manager, service manager, who's deeply involved in feeding our community and our tourists. And the comment is, it's pretty rough and almost embarrassing knowing that we have the highest incidence rate in the state. I can't help but think that if we'd placed more enforceable restrictions on the community in early November, we could have avoided getting here. That ship has sailed, and as it stands today, my opinion, he said, as one of many, is that the county has to get serious with enforcement, and that some of the initiatives, such as single families dining and lodging together, are not enforceable and therefore toothless. Aside from the consideration that the health of the community is at stake, the reputation of our city and our county's leadership is also increasingly at stake. We continue to put so many at risk to keep our economy flourishing. Sorry. We continue to put so many people at risk to keep our economy flourishing. Doing what we've done hasn't worked. And they say, quote, kowtowing to the business community has been good for business, but it's proving short-sighted for our health currently. That's a strong opinion coming from a restaurateur. So we also know there are many, many varying opinions on this. And so we have to navigate that. But I'll cede the floor now. Thank you.
Thank you very much, Greg. Tom?
I'd like to say that I'm listening to everyone on this matter, including what Greg just said. And I respect and admire the opinion of Jimmy Yeager and Chris from Cash, who said maybe shutting down the 9 restaurants that have had violations would have been of somewhat effect. And I respect also Steve Childs, who took the middle road position in the BOCC of saying wait for a week. But in general, I think that the impetus for the safety of this community is pushing somewhat of the status red that has been proposed by public health. And I would like for that to take into account, if we could, the 7-day moving average, in addition to the 14 moving average that I suggested earlier that CDC and Johns Hopkins uses, because that might give us an earlier clue of what the trends are as we adopt this. And I also respect the communities of Redstone and Meredith, if they wish an exemption, and no cases have been coming from that area, of exempting them as well.
Thank you very much, Tom, for your comment. And I'm going to ask Josh, our epidemiologist, on this 7-day, 14-day that Tom just discussed. Is that doable? Because I know reports come out at 7-day and 14.
Yep, absolutely. Yeah, I can get that added for tomorrow. I agree with Dr. Kurt that a 7-day average does make sense. We've been going with the 14 to be consistent with the state, but we can have both of those included in the daily reports. That way we could be tracking both.
That'd be much appreciated. Tom, thank you so much for that suggestion. That's very good. Patty?
Thank you, Marky. Just real quick, yeah, and Greg's point, yeah, it's a tough call because, you know, if we have to look at the big picture, and if shutting down the restaurants is the direction the board goes, we need to look again at, it's difficult to get the economics back into play to keep these people with food on their table. So I'm looking at the health of these children. One hand, we want to keep schools open, keep daycares open. At the same time, what are we doing to impact their family's financial situation to keep good food on the table of these families? So that's, I think, what makes our decision so hard. How do we protect our community's health at the same time? Are we affecting our community's health in other ways by shutting down restaurants? I, again, personally, not speaking for the Board of County Commissioners, don't see that just shutting down the restaurants in town, cutting them back, you know, totally to just take out is going to be where we need to go. I think if we're going to go that way, we need to look at bigger across the board. If we're going to hit the restaurant, we need to look at construction, we need to look at retail and all those things, so we have a bigger play in the factors. But I also think there is going to be a natural attrition rate. I'm looking at the numbers. We're starting now, maybe we don't know where it'll be tomorrow. We don't know anytime, but our numbers are kind of heading in that direction, but we still haven't had really the hit from the Christmas and New Year's holidays. So when the board makes their decision and votes, I just want them to really take into consideration the unintended or not intended, but just the consequences of this decision. The small picture part of it is the restaurants, but it has a big impact. And I think we just need to keep that in mind with the goal of being to protect the overall and the full health of our public, which takes into consideration not just one factor, but many. Thanks, Mark.
Thank you, Patty. Okay, further discussion. Yes, Jeannie?
Marky, I just want to make the comment that the science is there. We're not making restaurants the scapegoat. We know that whenever people are indoors without a mask, that is when transmission occurs. And that is indisputable. It's the science. And with that in mind, I implore the community to take that into account, because it's not just the restaurant, it's people getting together indoors. So they have to follow the public health orders. And looking at the trends in transmission, they're really horrible. And if we do nothing, we will be forced to go into red and have that 350 threshold instead of 700. And the writing is on the wall, we're heading there. And I don't want that to happen to our businesses. And then my other point is, we do have to think of the school children. Unless we get the incidence rates down, we're not going to be able to open the schools. The schools are remote this week because of all the quarantines. 152 kids are in quarantine, as well as 13 adults. And unless we get the rates down, we're not going to get our kids back in school. And the kids who are having remote learning are suffering lots of mental health issues and an educational slide. And we just have to stop this. And our job on the Board of Health is to protect our community's health as well as our kids. And that's all I have to say.
Anne?
Thanks, Marky. I'm really seeing, and from emails like the one that Greg just read, the scale is tipping from economic concerns to really serious anxiety about health. And I think everyone's feeling that this is closing in on us, where 2 months ago, maybe we didn't know that many people had been sick. Now we all know someone that's been exposed or quarantined or is really, really sick. And also the fact that it's affecting schools and affecting children. I also, it's not mentioned often, and it should be mentioned all the time, is the concern for our health workers. Well, we're worried about unemployment, and it's a serious problem, obviously, for workers in town. The opposite is for the health workers. They're overworked. They're burnt out. They're frustrated. They're exposed constantly. And the more cases we have in town, the more we let this get out of control, the more they're exposed, the more we're putting them in danger. A lot of complaints about enforcement, contact tracing, this kind of thing. It's because the case numbers are out of control. If we can get it under control, we can be more effective with the enforcement, with the contact tracing, and help our health workers do what they're trying to do. So to me, going with staff's recommendation and what I'd said previously about vaccines is what's going to help us get out of this.
Okay, thank you. And Brent?
Yeah, well, I just want to say that this, there is no non-position here. We've kicked this ball down the road. I think we've run out of road. Maybe we've run out of ball too. But I think at some point, right, there's no way to make a non-position. Whatever we do is going to affect people, and it's going to be painful. And this is basically a triage, which I'm sure to any physician is not fun, especially in emergency times. So whatever we're looking at, we are looking at the long-term benefit. I mean, truly, right? A few weeks out, hopefully things turn around. And then lastly, I just want to say the point with Jeannie, Ann Mullins brought up, the health workers, if you think about it, in our town and in places like Los Angeles, it is unbelievable. Truly, I see daily on TV with physicians crying, for God's sake, nurses breaking down. And we're asking these people to go in every day in a sea of disease, and they have their own families too. And at the very least, in my view, we owe them the respect to modify our behavior and to help these people that, have really now at this point, as far as I'm concerned, are going to heroic lengths to protect society. And we owe them whatever we can do to keep them as safe. They're the warriors really on the front lines fighting our battle here. So anyway, that's what I want to say. Thanks.
Thank you, Brent, very much. Kim, did you have a comment?
Yeah, I just wanted to thank Ann and Brent for bringing that up and echo Dr. Balco's comments today about there is a huge cumulative stress and exhaustion among healthcare workers, especially the front line. And while the hospital is open and it's safe and there's a drive and a desire to fight among all the healthcare workers, there's just been this long-term cumulative effects at this point. And we've gotten to the point where there's such that COVID is everywhere, that's such a high spread in the community that in the emergency departments, we don't know who has it and who doesn't. And it really creates a lot of, there's a lot of additional stress on top of that, just due to the high numbers that are now coming in through the emergency department consistently. And I also just wanted to remind everybody of the lag in data from, I know I've mentioned this before, but as the incident rate rises, there is a lag of at least 2 weeks of hospitalizations and at least 4 weeks of deaths. So if you look at our data and you say we've only had 4 deaths in this community and let's just keep everything open, how do you quantify a death and how do you quantify the value of long-term effects and the effects on people's lives and their ability to return to work and their lives? So all of this really needs to be considered and put together. And I know that this is one of the most intensely complex situations. It's the most difficult balancing act that we have here on the table. And really, I think my main message is that this is a group collaborative effort that every sector has a responsibility to put into this and fight for this, as the healthcare workers and the hospital has been doing. It's not a one sector is responsible as a solution, it's everybody is. And the more we can all put together and add to mitigating this is really going to be critical. So thank you.
Thank you very much, Kim. Other hands? I think Linda's went up. Okay, Linda?
I just want to say that this is a very difficult decision. We all are definitely in this together. I'd like to read you something that struck me, and quote unquote, while the dead are not your dead, you will not understand the gravity of what we are living through. And I thought of that when Christella spoke about her family member who just died. And we've been fortunate enough that not so many of us have died, but the numbers speak for themselves. The fact that we have an incidence rate of 3,000 cases per 100,000 people, and 1 in 35 of us is going to get infected, and the long-term health issues remain in 50% of those infected. And we haven't even talked about the 2 novel variants of the virus, which are now more infectious, up to 50% more infectious. So it's a known fact that getting together with people that are infected and don't even know they're infected is going to create a high level of transmission. So it is, I think this part of the solution is herd immunity by immunization. And I'm all for, all of us that can volunteering to immunize. And I think that's where part of the answer lies. But I just want to express that it's not something any of us are taking lightly. And my heart goes out to anyone that might suffer either financially or by the loss of a person through COVID. Thank you.
Any other comments? Yeah, Bill?
Yeah, just going back to the whole theory that we really should be following the numbers. And Kim had pointed out, the models are our best guess going forward. I guess my question is, we all know that January is a much slower time here, and that's in fact why winter school was created. So we're going to see smaller numbers in this next month, and how do we take that into calculation?
Good question, Josh or Jordana.
Yeah, Bill, I'd say with the current prevalence in our community and all the infection that we're seeing right now, even with January being slower, we're still waiting for the effects from the Christmas holiday, from other holidays, from New Year's. And so we expect to continue to see cases increase, even though we're in a slower period right now. So I think, it's useful to have less people here and have a slower period, but in terms of, whether or not that's actually going to reduce our case counts, I think it'd be hard to say that for certain. I think we'll continue to see case counts increase just given the holidays that we recently had.
Thank you, Josh. Greg?
I just want to say I saw Krista was there with her hand up. I don't know if Krista, you're still on or you still want to speak. If you do, I'll cede to you, but then I'd like to say something after.
Okay, Krista.
Yeah, thanks. I'm sorry. I just, I've been working this afternoon at clinic. I realized over the weekend when I was speaking to a number of people that a lot of people do not know I'm a practicing internal medicine physician for the Veterans Administration. And I do see a lot of people that work up in Aspen and are getting incredibly ill with COVID. I have 3 children that are home from school this week. And I think shame on us for allowing our kids again to be out of school and not have this under control. I really just second what Jeannie has said on this call. And I really feel very strongly that we cannot just continue status quo. I do not feel like I know what the answer is. Pitkin County Health has given us some great guidelines, and I think we should listen to what they've had to say.
Thank you, Krista. Greg?
Thanks, Marky. I just wanted to, because it's been brought up a few times, I thought I should share what my outcome of our board meeting this morning with the BOCC. And just to summarize quickly, you've heard a bit from Patty, but Steve and Patty were hesitant to try to shut down and go into red. Patty's worried that if we go into red, we might not get back out. Kelly, I think, is ready to do what it takes to shut this thing down regarding stopping the spread. She's extremely concerned about families and children and getting our schools back open. George supported the staff recommendation. So Kelly, I'd say, might have been a little bit more stringent regarding the staff recommendation. Steve and Patty, perhaps a bit less. George supported the staff, and I have to say I do too. Here, with what I'm hearing today, people's opinions may have changed a bit, but I think what that basically means is we have a majority of our board anyway is leaning toward going with the staff recommendations, but we've also discussed additional restrictions, meaning we want to share the burden, we want to share the mitigation, and we want to share the pain. We're not trying to punish restaurant workers, we're not singling them out, but it's important that the mitigation be spread through the community, and we all realize it's going to take the entire community to share this sacrifice to make this turnaround. I think, as somebody pointed out, the sooner we get into this and get moved toward the 5-star program, the better off we'll be, because we'll get out of it sooner. Let me see what else I have here. Kelly was concerned that operational concerns might really help us. If we have good information sharing from the restaurant community, from the hotel, the other worker communities, grocery stores, so that we have better contact tracing, as the restaurants implied they're doing, as some of them do, better understanding of the schedules and how these networks of employees in our community are communicating and interacting and transmitting with each other. Super important, but it's going to take everyone to participate and buy in. So then also general support from our board for incremental adjustments to retail capacities or retail restrictions, lodging restrictions. It was pointed out earlier today that there's an airline sale going on right now. They're trying to sell tickets to come to Aspen and get more people here. If we get a lot more people making reservations, hotel capacity could go above 30 or 40% it is now, and could get up into an area where it becomes much more concerning. I do know our public health will be monitoring that, and we may have to adjust this going forward. So continued monitoring, super important. But I guess to sum it up, I'm ready to support on behalf of my board, as my vote on the Board of Health, to support the recommendations. But I also want to see statements from ski company. I want to see statements from our law enforcement. I want to see what RAFTA is going to do, and our business community in general, on what we're all going to do to try to solve this problem together, because we're all in it together. And I think statements of support and concern and what they're going to do tangibly is going to be very important from all of these entities. Thanks.
And Greg, just in terms of logistics, in terms of what you want to hear from the RAFTAs of the world and SKICO, et cetera, are you suggesting that you want to hold on a decision until we see those statements?
No. I think what they're waiting for is a commitment from us. I think, okay. And I've heard that what some of these other entities are, they're waiting for the guidance and the Board of Health to take leadership. So I'm in no way suggesting we slow down. I'm suggesting we make a decision today, and they can adjust their course as necessary.
Okay, thank you. Tom?
I'd like to point out that the slides that Jordana showed do not necessarily only apply to the restaurant industry. She had a slide that applied to SKICO with better regulations of masks and other factors there, of the lodging industry with better registration of the affidavit, et cetera. So this is an overall program that she mentioned, but also includes the enrollment into the 5-star program. So please do not necessarily think, as I'm looking at it, that this only applies to the restaurant industry.
Thank you very much for that comment. Anyone else? Bill, and then Tori.
Yeah, I think I've been in touch with the superintendent of the school, and I think that it needs to be addressed because getting the kids back to school is super important. And basically, he's stating that does not believe additional restrictions will help the district reopen schools to in-person learning, as 57% of the spread is happening in homes and small gatherings. Taking the community to more restrictive measures is creating a climate where people don't want to get tested. They lie to contact tracers and are working from a place of hoping not to get sick and relying on best practices and mitigation. The other point that he makes is we need to change our quarantine protocol to mirror Down Valley schools. It would be much more helpful to get our kids and teachers back into classrooms. So I think that needs to be something that we consider.
Marky, can I give a staff response to
Sure.
our conversations with the school district thus far? So, you know, the first part of why we see spread in households, we're always going to see spread in households. You get it from someone in your household, but where does that person contract COVID? And that's somewhere out in the community. You know, we know why the stay home orders work, because if everyone just stays in their household, we don't transmit COVID anymore. So I would just use that information to state that is why we are proposing the measures that we are, because we have evidence that that spread is occurring, especially in these indoor situations where people are not wearing masks. So the point of needing to enforce additional informal gatherings, as we've listed on the that is one of the areas that we will need to continue to work and partner to see how we can continue to do that better. The second point about reducing quarantine length, we've continued to work with the schools to say that that is something that we can look into once our incidence rates come down. Right now, it doesn't behoove us to do that because the incidence rates are already incredibly high. We know risk is very high of catching this out in the community. We want to make sure that we are eliminating that risk once kids have been exposed to each other in school. Once risk lowers down, we can also look at those additional less restrictive quarantine measures, and that's all dependent on incidence rate.
Thank you, Jordan. Anyone else? Tori, you had your hand up.
Yeah, I just wanted to share the city council's perspective. We only have, our questions were surrounding the number of 700 as a trigger point for moving forward and coming out of any restrictions. But more than that, we are just interested in getting the 5-star program set up and operating. We would like to be getting businesses open under safe guidelines, and that is our priority. Not for business reasons, for public health reasons. So I want to, as we move forward on this, let's get to some of the details about what we are trying to enact, and I'll have some questions about those different parameters that we're setting up for ourselves. I think as Patty was sharing, you know, that's really the question for us, is that we want to know that we're making the right moves and seeing results, and then getting back to what we can do for the health and safety of our community at large. So as we start getting into some of these details, I'd like to just get clear about exactly the parameters that we're putting in place.
Thank you very much, Tori. I also received a text just a few minutes ago from another person that is in business, local here in our community. It's let's move forward. Let's focus on the 5-star program and then get reopened as soon as possible. So any other comments, discussion points? If not, let's go back to the staff recommendation, since we saw that 3 hours ago. So bring it back up, Jordana.
Thanks, Raleigh. Thank you.
Jordana, is this where you want to be?
I also put on the last slide.
Oh, perfect. I will go there. Thank you.
Jordana, you want to walk through each one of those one more time?
Sure. So the staff recommendation is to adopt new criteria for moving into and out of red level restrictions. So we would move into red level restrictions if the incidence rate is above 700 for 14 days, or if one metric is in red for 14 days and another dial metric goes into red for any period of time. We would move out of the red level restrictions as a county if the incidence rate is below 700 and has been decreasing for 14 days. And we would also apply for the 5-star program now and have 5-star certified businesses be able to operate at an increased capacity after 2 weeks sustained decline in red, as well as decreasing hospitalizations and decreasing positivity rate, or a positivity rate under 10% as outlined in the 5-star program.
Marky, I'd like to have some discussion on that, the 700 moving in and out, and putting that metric on ourselves.
Good point, because I was going to raise a question too. Tori, go for it.
Well, I just, again, setting ourselves with that that floor and ceiling is really limiting our ability to make decisions based on the data that we're getting. So I just don't understand the 700. I don't think that's appropriate. I don't know. I think that's too restrictive for us. We're already talking about moving into red level restrictions right now. So as far as this talking about what we need to go into it, I don't think that even needs to be there. But coming out of red level, again, what we want to be doing is getting into the 5-star certified program. And again, I still say that we could be doing that ourselves ASAP. We don't need to be doing that through the state. We could already be doing that. We could start tomorrow or later this week if that's what people think is best. We could start with closing indoor capacities, and then we can start getting certified businesses back open, in 2 weeks from now. So I just am concerned about the 700 level.
Okay, so let me understand here, Tori. So we have 3 different bullet points here. And what my understanding was from the staff, and this, Jordana, you're going to have to correct me when I'm wrong here, is we would go ahead and begin looking for getting approval for the 5-star program. And that would be at the state level. That's where I would disagree, Tori. But we need, if we were to do this, we would have to decrease our capacity or our incidence rate for 2 solid weeks. And people could still be applying for their 5-star program, even as we see the decline beginning to happen. So Jordana, do all 3 bullets apply, or can we just do the last bullet?
You are correct, Marky. The first thing to apply will be that last level of bullet. If we're moved into red, Tori, to your point, we have the application ready to go. We are getting letters of support. Going into red will close indoor dining. And as soon as we have this 2 weeks of sustained decline in red, as soon as that happens, our intention is to already have businesses lined up who have certified with the program to be able to operate when we see that completion of those 2 weeks sustained decline. And that's the first thing that's going to happen. To your point of why are we setting an incidence rate alone to come out of this is so that we have some goalposts. I totally understand goalposts have been changing this whole time, but If we don't say when as a county we want to move everyone from red into orange, we will just be coming back and having this values conversation over and over and over. So by having some metrics and making these twice the level of what the state outlines in the dial, right? The state says you need to hit 350 to go into orange. We feel like that, obviously this will happen sooner. It's still a capacity that we can continue to contact trace and box it in and have that be effective. And it gives us a target, and it recognizes that the incidence rate on its own in our community, we have seen how important of a factor that is.
Jordana, can you remind us when the governor's order went out to move counties from red to orange, what incident rates were those counties at? What was the range there?
Josh, you looked this up. I can pull that up, Tori. It was a range. They had decreased. Let me pause here and see if Josh can pull that up quickly so I don't misspeak.
Yeah, I tried to pull it up too, Jordana, so I get the right numbers.
Marky, can I just ask a question while Josh is looking that up?
Yeah, Bill, go ahead.
So if we were to stay in orange plus plus and do as Dr. Curd had suggested, is move our incident rate to 7 days, we can still then apply for the 5-star program, correct?
That is a question for Jordana.
I think what my understanding was that we would be also looking at the 7-day incidence rate as another one of our indicators that we're looking at. The 5-star program has requirements to be eligible, and we would have to follow those requirements to be able to be in the 5-star program according to the state. So we cannot change that requirement, but we can also calculate the 7-day average to give us a better idea of how the trend is moving.
But we don't have to be in the red to apply for the 5-star program.
No.
So if we were to stay the course, stay at the orange plus plus and apply for the 5-star program, that would be a way forward.
It wouldn't, to staff's recommendation, that wouldn't address our incidence rate. The measure that we've seen make the biggest difference in other counties is going to the full red restrictions of closing indoor dining. So that's, if we don't go to full red and that doesn't happen, I think that would be the bigger point than whether or not we can apply for 5-star.
But we would be taken into the red if we have our 2 indicators, which we don't have.
We're not being taken into the red for dining. The point of the matter is we're basically already in red with the exception of restaurants.
Right, and as I stated in my letter this week, I'm in favor of staying the course, staying orange plus plus, and allowing this January slower period to help bring down our incidence rate. And if we do meet the state level of having 2 indicators within the red, we would the state would move us into the red, and then we could use the 5-star program as kind of our backstop.
So Josh said earlier, and I'm listening to Josh, the expert here, is we haven't seen the impact of the holiday period, even though it may be a slower period of time. We do know that we don't have that impact yet. And I've seen no evidence that we have any slowing of the incidence rate at all, or the number of cases, day over day over day. And since well before Thanksgiving, that incident rate has continued to climb. So Josh, did you find that information?
Yeah, Margie, I just wanted to comment on what you just said. You know, 3,000, an incidence rate of 3,000 is extremely high, right? Even bringing it down to 1,500, we're still extremely high, much higher than many other counties. So on December 30th, when the governor put or asked counties to move from red to orange, it was a large range. So the incidence rates for those counties that were in the red at that time were anywhere between 334 and 3915. But those 4 counties that were over 1,000, they all had correctional facility outbreaks. So the rest of those, you take those 4 out, it was 334 to 984, with the average being 517. And I will note though that from the about the middle of December to the end of December, all counties in the red saw a decrease in their incidence rate, anywhere from -20 was the lowest, all the way up to -3,880, an average of 554. So all counties in the red, as Jordana has alluded to, did see a significant decrease in their incidence rate.
Okay, Tori, did that answer your question? You're muted.
It does answer some of that. I would still advocate for raising that floor level from 700 to 1,000 or some there. I just am very concerned about the ongoing health of the community, and if there's a floor that's going to be keeping us from doing the best decision making for our community, then I just don't want to support that. I would advocate for a higher level.
Maybe
if we see our trending down in that direction, and it's at that area, then we know that we're doing the right things.
Well,
and it's going to continue.
Well, the point of clarification was that what we would be implementing is bullet number 3.
Yeah.
Not bullet number 1 and 2.
Right.
Correct, Jordana?
I mean, I think we would recommend having a policy on all 3, right? The first thing that we would do is the 5-star program. And then we would need to know, well, it would be helpful to have a preset incidence rate at which we're going to move our county from red into orange. You know, as Josh said, at the state level, when the governor moved folks, the average incidence rate among counties in red was 517. So again, you know, the normal level was 350, the average was 517. We're suggesting, you know, something not as restrictive at that 700 rate, knowing that that's where we feel like our contact tracing can keep up and continue to box this in. What we think about when we're setting these levels is that if we set this too high to come out of the restrictions, that we lose all of the gains that we've just made. So, you know, if we come out too early and the incidence in the community spreads continues to happen, and we see our incidence rates go back up, then we would be pushed. If our incidence rate, we come out, we come back up, and we have to go back in is what we want to avoid. So by setting that at a lower level to come out, for all businesses who are not 5-star certified. This is only going to apply to the businesses who have not gone through the 5-star certification, right?
Yep.
You know, I think we want to have a level there where we feel more comfortable that we can use the other tools in our box to keep the incidence rates where they're at.
Okay, that's clarified. Okay. Any other comments from board members? If not, we'll move on to the next slide. Jordana, can you pull up the rest of the recommendations of staff?
Or so we can walk through the other recommendations, and I think that it would be great to hear from the board on these, but then also differentiate between what we need to put in the public health order, and then what actions that we will just be taking. So the additional measures of the mitigation efforts SCICO will be taking, how we'll be continuing to monitor lodging capacity. Raleigh, if you want to pull those up, I can tell you what slide to go to walk through those. I would suggest, you know, hearing from the Board of Health on what to proceed with, but that the public health order changes wouldn't include everything that we cover there. And that would start on slide 13. So there we go. 13 is what we've talked about. That's moving to red. The next slide are these additional measures. Do you want me to walk through them, Marky, or just kind of, how do you want to address those with the board?
Walk through them.
Okay, so this first slide is that the measures by SCICO. There's been agreement that they will improve mask and distancing enforcement. No indoor dining will align with the public health order change of going to red. Continue to monitor capacity and implement reservation system if target capacity is exceeded in accordance with the ski area plan. So the public health department and SCICO continue to meet and adjust the SCICO plan to meet the realities of what's happening with incidence rate and other things in the community. So that would be the direction.
Yeah, and Jordana, just to add that, you know, there's a statement before that SCICO is operating at 100%. That is not.
John, you're breaking up. So I don't know if you can maybe turn your video off and try again.
Can you hear me any better?
Yes.
Okay, sorry about that. I was just making the point that there was a earlier statement that SCICO is operating at 100%. That is not the case under the ski plan. And we have been monitoring those capacity levels to ensure compliance with that ski area plan.
Marky, can I make a quick comment? Greg here.
Sure.
Yeah, great. Just I really appreciate this overture from Ski Company, and I know that the discussions have been happening, so thank you for that. I did want to point out that when we have an interface, say with the Ski Company at the base of a ski area and the bus system, over the holidays, of course, it was busy, and I noticed, you know, throngs of people crowding to get onto the buses, and it wasn't something the driver alone of the bus could handle. And I saw many people get on and then get pushed off again when he realized he was over capacity. But at the time they were there, they're all clustered and uncomfortably close together. I don't think we're going to have throngs of people here like that, but I want to make sure that as we're looking at each one of these opportunities for transmission, that there's a protocol. And that might mean that a ski company employee needs to be there monitoring and directing the lines for people waiting to get on a bus. Simple as that, or a RAFTA person. I'm not sure who does that, but I wanted to point out that you can see the opportunities for transmission and spread in places like that. And so I'm hoping that's part of this this measure they're planning to take.
Thank you very much. Okay, moving on, Jordana.
So the next slide walks us through lodging. And so we continue to require that lodging enforce the one household per unit, regardless of when reservations were made. And that there's accountability for in the public health order, there's already accountability for the property management company as well as the customer. Here, an action is to continue to monitor capacity. If it looks like it will be exceeding 50% occupancy at any point, we can consider a capacity limit. And then I will leave that for board discussion if that is where they want to leave that.
Any comments from board relative to the lodging recommendation? Yeah, Greg.
I just received a text earlier regarding rental by owner issues, and that, of course, this should be applying across the county for rental by owner in lodging units. Mixing households probably shouldn't be happening there as well, and we need to be clear with that.
Definitely. I know that in the area where I live here in the village, there's several large rental homes with 2 and 3 households in them right now. So we're really going to have to step on this one with the Vicados of the world and Verbals.
Yeah. And
next.
Brent,
yes, Brent.
Just a quick comment on this, and I guess to John Sarpa's point, do we need or should we not consider when bookings would have to be canceled by? Is there some way we can keep current bookings out to some reasonable point, or I don't know what, dovetail it a little bit? Hate to be too extreme in that. Any thoughts?
I think that's a very good point, Brent. Appreciate that one. We are now at January 11th, perhaps 2 weeks. I don't know.
I mean, they're just pulling that out of thin air. Yeah, that sounds right. Although sooner or later we have to drop the hammer on this thing, but that might be sufficient notice. Who knows? Anyway, the thought.
And I don't think X Games is until the last weekend of January, isn't it? Who's in the know on X Games?
Asked me 50 years ago.
Well, I think it's generally always the last weekend. So the 2 weeks would be prior to X Games, which would impact John Sarpa's comment. Greg?
I just looking at my notes on what John Sarpa had said is the 50% being an average weekly would be one way of maybe helping take some of the pressure off there. Not that we're trying to increase the capacity, but we're trying to smooth out difficulties, because if they bump over 50% in one night out of 7, maybe that's not as significant. But he did mention that. I wanted to make sure we remembered to consider it.
So X Games is January 28th through 31st. And then in our prior public health order, it was tricky because I think we said reservations made before the date that we required one household were permitted to have up to 2 households. And if reservations were made after December 20 something, they were required to be in that 1 household, meeting that requirement. So now I'm hearing that we are having a definitive date of no matter when you've made your reservations, you will be required to have 1 household per unit. And I'm hearing a proposed start date to when that becomes effective.
Any comments? And that date would be 2 weeks or now? I would propose almost now. And with lodging, the consideration of not to do this on a night-to-night basis, but a week basis makes sense. The rest of you? I know we're all getting tired. Greg, your comments? Any comments there? Yeah, one household right now is the proposal I was going to suggest, which I did, was 2 weeks from now. Your thought? Greg?
I can't, Marky, I can't opine on that. I didn't have my hand up, or I didn't intend to. I'm at a point where I don't know what direction to go on that. I see the point of it, but I'm not sure quite how to implement it. I'm wondering if we can vote without going to that specificity on that particular topic. And there'll probably be some others as well regarding, like, are we allowing Redstone a variance, for instance? That just came in as well while you were asking me that.
Yeah.
So I'm just thinking, Jordana said something about what we need to actually put into our order versus what the specifics are. Pardon me.
Okay, Jordana, are you fine with that? So this is a recommendation coming from staff. And the 50% capacity would be made, done on a weekly basis. Okay.
Okay, and that's something that we would put into the public health order if we want it to be enforceable.
Right.
And then I'm hearing leave up to staff's decision when this becomes effective.
Right. Next. Any questions on this? I'll just ask each one of you to read the slide and see if there's any questions. It's very straightforward.
While people are considering it, Marky, regarding the traveler affidavit, I've heard great success stories from it where it actually prevented people with COVID from coming who decided not to come because they got tested based on the affidavit. I've also heard from people who say that there's a high level of ignorance or disregard for the affidavit and people can come anyway without it. So we're probably seeing the full range. If there is enforcement capacity or an increased presence for implementing the affidavit, I'd like to see what the opportunities are. That doesn't have to be articulated now, but I think there is room for improvement. I do know airlines around the world are beginning to use this protocol before people travel. So it's not going to be so uncommon for us to demand it as well. So I don't think we should be shy from demanding it, as some people and businesses have been. That said, you know, are we going to be able to get the community to demand it from our visitors? Because I think it's a way forward.
I agree with everything you're saying. So perhaps with the building out the enforcement piece, and really, I think our lodging is doing a really good job looking for that traveler affidavit. For people coming in from Denver, driving in, that's pretty difficult, particularly if they've rented a verbal.
I think that enforcement piece really needs to be addressed in all areas.
Right, right. Okay, let's move on to the next slide. Any comments here? Any questions? Greg, did you have one?
Yeah, I keep fielding questions from others, so sorry I don't want to take up time if anyone else wants to speak. Regarding supporting local businesses and takeout, I would love to see an incentive and promotion program for supporting our local businesses, whether it's restaurants or stores, retail, whatever. If we can incentivize people locally to buy a gift certificate or restaurant certificate program, perhaps we can put out a challenge that will help subsidize a small part of it or something, so we can encourage people. You may not want to take a chance going out to a meal now, but you might in a few months. Why not buy someone a certificate, or buy a future for a great meal in one of our local restaurants? I'd certainly like to try to promote that and other ways of keeping the money circulating locally.
I just had another comment come in. And this person does manage some properties here in Snowmass. And one of his comments was, a major issue I've been seeing is not all the businesses are taking the COVID problem seriously. Too many businesses are not being consistent in the application of the restrictions. Communities which are united in standards have seen the reductions. Enforcement is extremely important. Mesa County, for example, where he has another home 5-star program, started in June, which is possible why they have seen the reductions. There you go. So that's other comments coming in from community. And
Could somebody speak about the report card?
Sure.
Just
Jordana, and then I'll call on Ann.
Sure. So, Chori, the state, in response to this question from counties who were initially in the red level and needing to see that 14-day decline before they were eligible to reduce, to have businesses who are 5-star certified operate at less restrictive capacity levels, they developed their own report cards. So they publish on Tuesdays and Thursdays the updated report card for each county. And it clearly states, am I eligible for the 5-star? What are the 3 metrics in my county? And so I just wanted to be clear that that was the measure that we would be using for whether we were, that's whether we're eligible for 5-star. And then this slide was saying, we are happy to post that on our website so that the community has the information of where we're at and how we're judging that.
Thank you.
Okay, moving on.
Yeah,
Ann, I'm sorry.
Thanks, Marky. And I was just going to add to the enforcement thing. As I said before, once we get the cases under control, I mean, right now, especially contact tracing is almost impossible with the number of cases we have. Once we get those under control, I'm betting that our contact tracing and enforcement will be more doable, just more feasible to get done.
That is exactly what the goal is. And thank you, Ann, for that comment. Other comments from the board? Jordana, any further on the presentation, or is this it?
That's it.
Mark, you had another question just came in from Francie, our future commissioner as of, is it tomorrow, I believe. Francie Jacober will be joining us on the board. And she just wanted some clarity. She's listening in and wanted to know about Redstone. Redstone and Meredith were brought up. I know we have opinions on whether or not we should be continuous and have continuity throughout the entire county, but maybe there's a place to have an exception for a place like Redstone, which seems to have, according to them, a flawless record. Who will make that call and who would they talk to? Is that something public health will put together regarding a policy with Redstone, or is that something we need to decide tonight?
We would need to decide that tonight to go into the public health order. So that would be part of the motion of staff recommendation, and with exception for Redstone and Meredith.
And would it be helpful to, I'll give my EPI team a little bit of time if there's anything that we can pull up just to state the number of cases that we have had reported to us in Redstone, and if any applicable outbreaks.
Okay, we'll wait till the team pulls that up before we potentially put that in the order. Yeah, Bill?
Yeah, give me like 2 minutes.
Okay, Bill, you had a question.
Well, I'd like Snowmass Village to be considered as well with Redstone and Meredith. Our incidence rates are lower in Snowmass Village.
Well, I may as well pile on, Marky. As Bill, you made the point very clearly that, you know, where do you stop? I just got one that said, well, then what about Woody Creek?
Woody Creek.
So you might see that this isn't going a direction that we can really, you know, as much as we'd like to reward Redstone, it just might not make sense. And I guess we're probably going to see more numbers from public health regarding, you know, if there have been no cases there, that would be a miraculous, I think. But I have a feeling that this isn't going to go anywhere.
I think the practicality is you'd end up with this fractionalized out, and the staff has got enough to do as it is. And this would now be a number of independent arguments, right? That to give them all due respect, but you'd have to listen to and counter. And I think at some point it just gets overwhelming.
Yeah, I'm a believer that we need to leave everybody in the county just for that sheer reason. Because we do know that people come from Redstone up to the ski mountain to ski. So you can't exclude them unless you put a barrier that you're not allowed to come into this portion of Pickens County. That's absolutely not possible. Okay, other people? So Greg, did that answer that question for you for your new commissioner coming in? Okay. So I don't see any hands going up. So now becomes the difficult, very difficult decision after listening to all the public comment, listening to our epidemiologists, listening to the staff recommendation. So therefore, I'll see if there's a motion.
Mark, before you
go ahead, Tori.
I do have a question about the last slide of the listing of outbreak incidents, and that, you know, I'm a little concerned about that. I'm not sure, you know, I know that information was previously kind of somewhat protected by our public health team. And I'm just wondering about what their feeling is on that. That was a suggestion that came up last week, but it was really kind of from I believe it was more from a personal inquiry. Can somebody speak to that? I'm a little concerned about that public listing or how we're going to handle that, what that looks like.
Good point, Jordana.
So outbreak data is currently reported on the state website, so it is available. Our thinking as the department is still that making that information public in a very out there in your face kind of way is not the most helpful information to single out businesses, because by the time that, you know, as everyone said, people have reported, they've worked with us, they've taken the measures to address it in their setting. The warning that there's been an outbreak there is usually no longer a risk to the public of going there, right? So we didn't think that it really gained anything by making those very public. We can certainly share the total aggregate number and those reports. I'd love to hear what the board thinks about posting the reports that you get at those daily updates on the website. If that would be more information and helpful to the public, we'd be happy to do that. And that gives those outbreak numbers in aggregate in a more easy to understand format, as well as the consumer protection numbers in aggregate.
I think that'd be very helpful to the public so they could pull up the reports. They're excellent reports. And I understand some individual desire to know where certain restaurants or businesses have impacted the community. And I agree with you, Jordana, in aggregate is a better way to go. Brent?
I was just going to say the same thing. I think that's a really good point. You know, if we're not supplying information that people can make, convert into real-time decisions, then, you know, what are we doing? It almost could work against us. Certainly the public would always be behind in this thing. The newspaper can pick out some, you know, really egregious kind of thing if they want to run with it. But I don't think, I agree with Jordana. I think we need to be just a little careful of not protecting this, but not widely disseminating it, because it's probably not going to be timely.
I totally agree. And it also has the inverse impact. Correct. And it would be a black eye on that particular business, which is not healthy for an economy coming back after we get through this very difficult period of time. So, other comments?
This is Krista. I do think that publishing the report that does get mailed to the select group of us that it does would be helpful. I have a lot of people that are asking me for that, and I think making that more widely available would be something the public would appreciate.
Okay, we can post that on the public health website. Greg?
I just wanted to say this has kind of gone around a couple times. Maybe it was in my previous meeting today, but there's a point where you have to worry about unintended consequences. And I think we've touched on that here. But if we're disincentivizing people from contact tracing in any way, I'm not sure there's any gain to be had. And I was a proponent earlier of trying to, you know, post information about outbreaks. And I realized, you know, what you might be doing is just stopping the flow of information together. Once again, our entire community is in this together, and we need to help them, and hopefully they'll be helping us as we all try to pull through this. So I'm concerned, and I'm hoping that maybe there's a longer discussion there. But I would say as of this evening, I wouldn't support calling any organization out. Certainly publishing numbers so people will know in general how we're doing, as we have been, makes sense, but I'm concerned on that topic alone about the unintended consequences there.
You know, I would say, just to join in, I think Greg has really hit on something. I completely agree. It's got a built-in unintended consequences. You're going to be disincentivized from reporting, or you're going to be careful. We actually want to encourage exactly the opposite, to report anything, so that, you know, and with identities at least somewhat masked. And other companies, the airlines for one, have huge programs of where you can report improper activities, and it's all kept very secret in order to encourage the reporting. So I think that's really an important point, something that needs a little more thinking.
Okay. Any other comments? Any other questions for staff? Yes, Tom.
Well, and overall, I'm for this program. I think that it unevenly is punitive for the restaurant industry. And that's the only place, not the lodging, not Skico, where people are going to lose jobs. I wish that it were a more evenly incentivized program, than what we're considering. So I'm not necessarily going to move it or second it, but if someone else wants to propose it, I'll vote in favor.
Okay. Do I have any board member that would like? Jeannie?
I'll make a motion to approve the staff recommendations. We have to do something to stop this transmission before things really get out of hand. And when all the tourists come in February, March for their ski weeks, there won't be a ski week because they'll choose to go somewhere else unless we control this virus.
Okay, Jeannie has made a motion for approval of the staff recommendation. Do I have a second?
Second. Oops.
Thank you, Brent. Further discussion? Yeah, Tori?
Please. You know, I agree with Jeannie that something needs to be done, but I don't know that this program, as we're putting it in place, is as swift or as incising as we should be. Again, you know, my recommendation was to start any closures, get testing done, keep businesses closed that are not able to adhere to the restrictions that are in place. But I do feel like this is just a larger blanket than we need to be throwing on this, and we could be more incisive by what we're doing. I will support these measures only because the rest of my board is supportive of doing something. But I don't think that this is exactly the scalpel that we should be using.
Okay, Tom?
I agree with Tori.
Yeah, Bill?
Yeah, I also agree. I don't think this is the blanket that's going to solve the problem. I just, you know, going back to that same theme, we're not going to enforce our way out of this. We really need to change people's habits. And if we can really focus on messaging and telling people what the expectations are when they come to our town, we're going to have much greater success than having a lockdown and putting a lot of people out of work and just creating an economic hardship that's really going to be difficult for many people. And I think there's a huge unintended consequence there. And I'm sorry, I just can't support it.
Okay, Brent?
Well, just,
Sorry.
Brent?
well, I was just gonna say, you know, this thing is very obviously, you know, fraught, and there's no easy way out. And I hear what Bill has said and Tori, and I agree. This may not be the best scalpel in the drawer, but we need it. But we need to use a scalpel. It's really as simple as that. We need to do something, and this is not perfect. In fact, it's a long way from perfect. But we have thrown away, through misadventure, all of the other weapons. We should have closed down months ago. We didn't. The world should have done things 8 or 9 months ago that it didn't. And it's not necessarily does it fall on the people making decisions. We were just behind this thing, and none of us had seen pandemics before, and so forth and so on. But the reality is we're down to very little weapons, and the only weapons we've got left now, right? We can vaccinate our way out of this. We have to wait for that. But in the meantime, we've got social distancing and masking and so forth. And to the point, we can't message our way out of this. I think society has proven, at least I think, that messaging is certainly important, but a lot of people won't change their behavior. We have to change it for them in a sense. And this has been proven. This is why Los Angeles is in a complete lockdown, and why much of Europe is in a complete lockdown. And all the, at least I understand, all the ski areas in Europe, except for maybe Austria, you can't ski. They're all in lockdown. And it arguably is not fair. And it's a broad brush, but it's the only brush they had available. And I think that's kind of what we're down to at this point. We have to do something. So.
I agree with you, Brent. I think we've gone from orange to orange plus to orange plus plus, and things have just gotten worse. So we have to do something. We're getting to the point where we will have 3 hospitalizations. It could happen this week, and we will be forced to go into red without the 700 threshold. We will be at the 350 threshold, and it will take us longer to climb out of that hole. So I have to support this right now.
Thank you, Jeannie. Any other comments? I just got another message from a former mayor stating we need to do this. We should have closed down before Christmas, but we didn't. We kept open during Thanksgiving. And as you look back at Brent, thank you for reminding us. We might have been able to tap it down. Greg, your hand went up.
Yeah, just from a former or a soon-to-be former commissioner, George Newman said, just as a point of order, the public comments closed for your, as you called the vote. So I think that we need to close that or keep it closed in case you were tempted by more emails and things coming in, as we all are. he also mentions that a consistent policy for the county is a good thing. And that was regarding Redstone, and that the point of order. So those are the two things. I just wanted to say, I agree. What I heard Brent say right now was very clear, and I'm not going to blame us for doing the wrong things. I'm going to say that we did the research and we tried to do what we could to keep the community going and the economy going, and we've made it this far. But now it's time to make a more drastic change. Billy, we've communicated till our eyes were falling out, and we're screaming what we want people to do regarding the affidavit and the outreach, and yet we still have a lot of people either ignoring or not agreeing with us. And I think I agree with Brent again. It's time we have to do this, and it's painful. It's not forever, and the sooner we get through it, maybe we'll all look back at this and say, "Wow, I'm glad we did it then, and didn't wait till March for this to happen." And as Jeannie points out, going into red involuntarily puts us down at a much lower threshold, which is even harder to reach. So I'm going to support this.
Okay. Any other comments? If not, I'm going to call the question. Okay. All in support, raise your right hand. Okay, unanimous. Okay, thank you all. This was a very difficult meeting, a very difficult discussion, and very, very hard on every one of the businesses that will be impacted. But let's see if we can possibly turn this. We've got to turn it around. Jordana, you'll be issuing the public health order tomorrow?
Yes.
Okay. Any other questions for Jordana?
I just want to make one statement to thank all of the healthcare workers, and I mean everybody at the Board of Health. And I know every time we, make changes and whatever else, everybody gets buried in the putting together these programs. And my God, I mean it's really overwhelming, and I just want to say how much I know we all appreciate this, and I'm sure the public doesn't see what goes on behind, and it's just an incredible amount of work, and I certainly appreciate everybody's contribution to that and the staff.
Thank you very much, Brent. I echo everything you're saying. I know people worked all weekend. People came together and they did it on behalf of the community, and everybody wants to get out of this situation. And Greg, you had your hand up for final comment.
Only that I've already been asked for clarification on the dates on when do we expect this to come down, so that the word can get out.
Okay, Jordana.
So what was voted on was that the public health order will be issued tomorrow and will go into effect on Friday, the 15th.
Will that be Friday morning at 8 a.m. or Friday morning at 5 p.m.? Those are the questions, huh?
Friday morning, yeah, I don't know. Friday morning or 12 a.m. on Thursday night. So for Friday, anytime that is a day time of Friday the 15th.
Okay, that's very helpful. Any other questions or closing comments? Yeah, Tom.
Yeah, I want to comment complimenting Jordana for getting the immunization program started with dispatch, and it seemed to go, as I heard reported, at AVH so well on this Saturday, as well to Dave Ressler and all staff that implemented this.
Thanks.
Thank you very much.
And I would push that thank you down to all of the staff at AVH and from our public health department and community health services who have been on the front lines of making that happen. Marky, one additional confirmation just before everyone signs off is our next Board of Health meeting was regularly scheduled for Thursday. And I think we probably need to move that.
Well, absolutely. We're not going to work again on Thursday. How about 2 weeks from Thursday?
I was going to suggest a week, only in that we've just made some big changes and we're going to expect unintended consequences, and we may need to check in, if only briefly, in a week. I just suggest that. While we're doing thank yous, if I could as well, there's so many other players in this, and I did want to reach out and thank, RAFTA and the ski company and our other partners in the community. We have to thank everyone, because this is going to take all of us, and it's painful, and it's makes me nauseous to have to think about what we have to do here. But we've got to thank everybody, and we've got to move forward. I did want to point out that regarding skiing and ski company, I've seen incredible line maintenance and management with the ski lift lines and the mask signs. And so I think they're doing the right things, and they're going to be a good partner, and they want to keep us open too, of course. So thank you for that.
Jordana, are you comfortable a week from Thursday? I just think of all the work the staff has to do to put all this in place.
I would commit to, I'd be happy to send an update. And if there is anything that the board needs to vote on, you've seen we have no hesitancy in calling emergency special Board of Health meetings. But that would be my proposal.
I'm fine with that. And Jordana and I do speak on a regular basis as well. So
we will not have any formal meeting set, or when will our next meeting be?
2 weeks from Thursday, with updates. And if we needed to have a meeting, Jordana and myself will work on calling that. Okay, Bill? And then,
just while we're passing out thank yous, I think it's important to recognize the restaurant industry and the 3,500 people who signed the petition to try and keep their businesses open. And I apologize, and hopefully brighter times are ahead.
well, we've got to have brighter times. We've got to have a light at the end of this tunnel, for sure. And I do echo your thank you to all of the restaurants who work so hard. And the petition and all the comments, we just got to pull it and make this darn thing go away. Tori?
Yeah, real quick, I just wanted to talk about the effective date of Friday. What the thinking there is. Are we doing that because we want to give restaurants a time to go through perishables and things like that? Is Friday the best start for that? Do we get any benefit by allowing Friday and starting it Friday night? Should we be starting it tomorrow? I just wanted to hear the reasoning behind the Friday start. Greg was asking kind of along the same lines. And then I'd also like, Jordana, can you just give us maybe a glimpse at the next couple of weeks? I think a lot of us are hoping that this kind of restriction is only going to be necessary for a few weeks. What is the outlook there, Jordana? What are you thinking?
We are going to be watching the data. To everyone's point, I think closing indoor dining should have an effect in a couple of weeks, as we've seen in other counties. It's also, to everyone's point, going to be the individual actions that everyone takes from now forward. So continuing to only have gatherings with those in your household, continuing to mask and distance and follow all of the other restrictions in the public health order. So Tori, we, again, don't have that crystal ball, and we hope to see the decline in the next couple of weeks. We'll be working hard on applying for the 5-star program, getting all of those things in place in the meantime. And we will continue to communicate with the board and the community as to, where we are with our incidence rates and trend lines. With regards to your first question around the timing, what we had heard was that restaurants would appreciate, 5 to 7 days notice before, when we met last Thursday. We also wanted to give our economic services partners who would be seeing some folks come their way some headway. So my timing was, knowing that this was on the table last Thursday, giving a full 7 days from then to that effective date of Friday. But that of course is the board's decision as to what the best date to make this public health order change become effective.
Greg, did your hand go up?
Well, yeah, I'm sorry, fielding just a thought that if it got pushed an extra day, would that be, what are the consequences for this if it got pushed to Sunday night or Saturday or Sunday morning or something like that, to allow restaurant inventory to deplete that much more? Are we making a compromise that's not advisable? I just had a question, and I wanted to know if it's going to make things a little bit easier for the restaurants to prepare to get them to Sunday morning rather than Friday morning, for instance.
Yeah, Greg, I don't think that we can quantify what that difference is.
Right.
We know how many people, Josh, maybe if you're still on, you can say how many people on average a day, we're seeing report cases, and that we know, the more days we go without putting anything else into effect, we don't expect that number to decrease on its own. But that's what we're weighing, right? We're going to weigh if this is going to be the difference between helping these businesses who are going to have to close indoor dining out in the long run, versus what the potential impact might be for a couple more days of increasing that risk of transmission in those indoor environments.
Thank you. It was a question that was asked of me if we could possibly go an extra day or maybe till Sunday morning. I don't know what Tori or Bill have heard about that from anyone, but it's just to make sure. I know we talked about giving restaurants plenty of time to deplete inventory or perishable inventory. If that helps, that might make a difference. And I'd love to be able to do what we can for them and still stay on track, but I can propose that, and if anybody seconds it, I suppose we can decide if that's how it has to go.
So we have a motion for a Sunday morning from Greg.
I'll second it.
Thank you, Tori. Other discussion? Brent?
Oh, well, I think it's a good argument. My intuition says no, and I don't know quite why. I'm a little afraid that, by delaying, there's negatives either way. I would go along with it. We certainly don't want to hurt anybody unnecessarily, but yeah, so that's my comment.
A Sunday morning, which is really Saturday night, like 12:01 on Sunday morning.
Yeah, I mean, that's a minor compromise.
Okay, we have a motion, we have a second. Further discussion? All in support of that, please raise your right hand. Okay, you have unanimous support there. Okay, any further discussion or closing comments? If not, I'm going to ask for. Thank you very much, Tom. Do I have a second?
Second.
Thank you. All in support? Raise your hand. Boy, this has been a long meeting, but boy, wow. Thank you all. Thank you to all of the participants. There were well over 1,000 people listening to this conversation today. And I ask our hospital staff to be safe and healthy. And let's continue to work towards not ever getting our ICU to 3 patients. So.
Thank you, Marky. Great job today. Thank you for carrying that.
That was a hard. Take care. Bye-bye.
Thank you, Marky.
Thank you,
Thank you,
everyone.
Georgiana, if you're still there. Thank you, Georgiana.
Thanks, everyone.